Hello, doctors. Once again, welcome back to our channel after so many days. So, Fmge exam and Neet PG are just coming one after another. So, what we're going to do this time, a little bit different, and I think it's going to be very efficient for all of you because we have made 70 questions. I have made 70 questions. 70 questions. The topics are selected from examiner's favorite topic. That means FMG, NEET, PG, INICT, from all these exams, the topic which are repeatedly asked and the examiner likes it or what you can expect it. So that 70 question I have compiled together. Okay, questions are new. And then mostly you can see a lot of match the following pattern because match the following becoming popular in the exams these days. Not only that, in match the following, what happened? You can revise 4 questions at a time. So the questions are standard or easy, some maybe a little bit difficult, no need to worry. So students who haven't had any plan or thinking micro is too difficult, I won't revise, this would be best to revise. I say almost it covers 70 to 80% of everything. Yes, I'm sure about that. So if you don't have any other plan, you want to do something very quick, within 4 or 5 hours revision, you want to finish micro, sir, then you can go through this notes. This will be very efficient. Okay, I promise you. And you must know because the questions are frequently asked from this type of questions in this pattern only. Okay, so let's start. So for starting, we are going to start with we're going to start with parasitology this time because a lot of pictures are coming, diagrams are coming, especially eggs, worms, and then whatever. So we're going to do with the parasitology so that, it goes in order. So the first question itself, let's start. Match the following. So they have given you 4 cancers. You can see they have provided you 4 carcinomas. And these are the options. First one is a urinary bladder carcinoma, cholangiocarcinoma, nasopharyngeal, and cervical carcinoma. Okay, fine. So, you know that urinary bladder carcinoma, there is no option. They don't give any parasite here. Something related to that only you have to find. So, urinary bladder carcinoma, you're going to revise with me. Okay, you're going to revise with me. When you say urinary bladder carcinoma, you're going to say cystosoma. Cystosoma. You know that cystosoma causes the squamous cell carcinoma of the urinary bladder. Yes for yes, yes for cystosoma. Cystosoma, urinary bladder carcinoma. Done. Cholangiocarcinoma, you already have a clue. Bile duct carcinoma, cholangiocarcinoma. What is the answer? Clonorhynchus sinensis. Okay, clonorhynchus sinensis. Okay, C for C, another easy question. S for yes, squamous cell carcinoma of the urinary bladder, cystosoma. C for clonorhynchus causes the cholangiocarcinoma. Nasopharyngeal carcinoma, everybody's popular question, Epstein-Barr virus. Epstein-Barr virus, okay, with all other lymphomas, not only nasopharyngeal, any Hodgkin, non-Hodgkin, Hodgkin, non-Hodgkin, all the types of lymphomas will be caused by your Epstein-Barr virus. You know that. Not only that, even gastric carcinoma, apart from H. pylori, Epstein-Barr virus causes gastric carcinoma also. Okay, and Burkitt's lymphoma, again type of non-Hodgkin. All the lymphomas comes under Epstein-Barr virus. Expect one question from there. Okay, even your oral Harry leukoplegia. Leukoplegia. Basically, oral leukoplegia. Okay. Don't forget. This is a precancerous caused by Epstein-Barr virus. So these are the cancers. So we have revised a cancer of Epstein-Barr virus. What about cervical? Very classic HPV, human papillomavirus. Not only that, it causes anal carcinoma. Not only that, it causes anal carcinoma. Not only cervix, it also causes vaginal carcinoma. To some extent, it can cause oral, and pharyngeal, laryngeal also. Oral, pharyngeal, laryngeal carcinoma also. Except nose. Okay, that was one of the exam they asked. There is no particularly nasal carcinoma. Rest all sexual route, whatever possible, everywhere HPV is common. You got it? Now we have to match with the other side. So, even you talk about cystosoma, what are you going to say? Very classic, yes for cystosoma. Yes for cystos have what? Spine. So, that's a clue for you. But non-operculated egg. You know that cystos, non-operculated means the egg doesn't have a lid. It is closed. It's a closed egg. Okay? Covered egg or closed egg. There is no any lid. So sisters are covered. We remember like that, no? Cystosoma sisters. Sisters are, sisters in the chest are completely covered. So they're not open, non-operculated, and they have spine. Yes for S, yes for spine. So your answer for urinary bladder carcinoma is this. Correct, right? Cholangiocarcinoma, we told clonorhynchus. Clonorhynchus characteristic feature is it is operculated egg. Because you remember the shortcut, we'll talk about that in now. I'll tell you how to remember. So in that, when you talk about trematode, the only non-operculated is cystosoma. Rest all are operculated eggs, right? You know that one. Okay. Now, nasopharyngeal carcinoma, as we told, is Epstein-Barr virus. Classic Epstein-Barr virus test is Paul-Bunel test. Paul Bunner test or monospot? Monospot. We already spoke like that. Epstein bar, B for bar, and we told that Paul with his girlfriend, okay, at the age of 21, he goes to the bar to drink his first alcohol, and that's a clue we remembered, right? So that's Paul Bunner test. Monospot test. Monospot is another test. They are heterophile test. We call these two tests as a heterophile antigen test. Okay, heterophile antigens. Okay, heterophile antigen antibody detection test. Okay, so Paul Bunner, monospot, Epstein Barr virus, another clue. If you forgot also, Bunnell B, Epstein Barr virus, Bunnell. Okay, Paul Bunnell. Okay, that also you can remember. Cervical carcinoma, you know, the main reason for HPV virus, the carcinogenic proteins of this one, E6 and E7. Classic question. Another question. This chart has for you 10 questions. 10 possible questions we discussed. It's possible for your Fmge and Neet PG or Inicet. So doctors, be ready. Okay. Yes. So E6, you know that E6 inhibits the P53, whereas your E7 inhibits the RB. They are anti-cancer, they are anti-tumor proteins, they are inhibiting it. Okay, so we got another question clear. So accordingly, you're going to choose the option. I'm not going to write the option because I've directly marked it, but if you want to, what A stands for 3, A3, B1, C4, and then D is 2. Fine. Okay, option 2. So here are some pictures which they can ask. This is the operculated, non-operculated egg. When you see a lid, see here it is a lid like opening. So this is called operculated egg. Operculated egg. Okay, there is a lid. So it is open. Here these are non-operculated eggs. Non-operculated eggs. With the, you can see a beautiful spine here. These are the spines. Okay, here is a spine and here is a spine. So this is all our schistosoma species. This all are schistosoma species. They are non-operculated eggs. Okay, so schistosoma non-operculated. We know that if the spine is at the side, we say what? Schistosoma mansi. We said that Mansoni has a Mansoni. This girl Mansi has a pimple on the side. She has a pimple on the side. So Mansoni. When it is terminal, T for terminal. So this is schistosoma hematobium. Hematobium, T for terminal, which is the one causing the urinary bladder carcinoma. Just now we spoke. When you see a small nose-like knob, who has the small nose? Japanese people. So Schistosoma japonicum egg. Okay, so this is a clue I'm giving you. Don't forget for schistosoma, we are revising everything about schistosoma now because an important question, your latest question came in your recent INCT was they cause what they also call, they got different type of itch. We have skin time, so this is called skin itch. Okay, I'm going to write it here. Swimmer's itch, swimmer's itch. We call swimmer's itch. So you see, everything is yes. Spine, schistosoma, swimmer's itch, and of course, snail is the only second intermediate host. Okay, that's all fine. So this is non-operculated. Only non-operculated egg is your this thing. Rest all are operculated eggs. Okay, so if you talk about trematode, in trematode we have what is clonorhynchus. Another one is your paragonimus. Other one is your fasciolopsis. No need to know all the details, but I'm saying these things are operculated egg, but only your schistosoma is non-operculated. Sister is single. Okay, we say single because there's only one intermediate host. That's fine. Okay, so these are all the important things you know. Okay, fine. Okay, so you know about the schistosoma now very well. Okay, now let's go to the next question. Match the vectors with the disease. Okay, when you talk about the disease, first of all, elephantiasis. We know that who has an elephant? According, we have a clue. Elephants, who gets elephant? Coolies. We said coolies, they get elephant. Coolies, they work in the Japan and West Nile. We told coolies work in the Japan and West Nile, and they get what? Elephant is big leg. They get elephantiasis. So what I'm talking when I say coolies, you know coolies who's working in the laborers. We call coolies. So coolie is for Culex mosquito. So I already gave you Culex. So it is Culex mosquito. Okay, easy. Culex mosquito. You can have vectors. And another important question, examiners directly asking. Every year I see one question is coming from just the vectors. Okay, so that's what I put as some important vectors which you can't forget. What about river blindness? River blindness, you know that when you talk about river blindness, you see the picture below. So you see here is a river. This is a beautiful picture to easy number. And you see on the top of the river, there's a bridge. What is going? A bus is going. What bus? Volvo bus. Okay, a Volvo bus is going. And suddenly what happened? It falls into the river. And who is driving inside? Black Simu. Our black Simran or Simu, whoever you want. Our black Simu is going inside the Volvo. This is a story to remember the disease. I'll tell you what disease in a while. Okay. So black Simu is going in a Volvo bus. It falls into the river and he ends up getting blind. Okay. He ends up getting blind. He becomes blind. Okay. So what I mean to say here, Volvo because it is Onchocerca volvulus. Onchocerca volvulus is the parasite. Black simu because the vector name is called black fly or otherwise called as simulium. Simulium. Simulium we call simulium. Simu black simulium. What happened when they're going in the river? River blind because the disease caused by it is called river blindness. Okay, river blindness. So that's it. So black simu is getting river blindness. Okay, so black blindness. So idea is black fly or simulium. So this question can be asked for you. So river blindness goes to simulium. Simulium. Easy one. Okay, you're going to get it correct. What about the Calabar swelling? Calabar, I always say the students, doctors to remember. Malabar. Remember Malabar. In Kerala, you know that in Kerala we have what? We have Malabar. In Kerala we have Malabar. Malabar. You see in the Malabar, Malabar, I'm going to write it Calabar. Okay, Calabar. It's a Malabar. So in Malabar, what happened? You see this deer is crying. The deer is crying. How it's crying? Low, 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 low. Okay, like low, low, like making sound and it's crying. Okay, so you got the answer what I'm talking about. So Calabar, deer is a deer fly, deer fly. Okay, crying because the other name of this deer fly is chrysops, chrysops, chrysops. Okay, lower, lower. The disease name is called lower, lower. Okay, it is basically eye worm. We call it as eye worm. Okay, you can see worm in the eye. So what should I choose now here? Calabar. Calabar is a Malabar. Malabar means what? Crying. What crying? Deer is crying. Chrysops or otherwise called deer fly. Okay. Simulium is called black fly. Black Simran, black Simu, deer, deer cries low, 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 low. Everything is there. You don't have to mug it up. You saw this crazy funny pictures and the ideas I'm giving you. Enough. Okay, so it will be a very good revision for you people. Okay, now Chagas disease. Chagas, I am always, whenever Chagas comes, you know how I remember. You guys already know that. I say it as Vegas. Vegas is Chagas. For me, Chagas is Vegas. So why Vegas? Who lives in the Vegas? Definitely our kissing guy, Tom Cruise. You know our Tom Cruise. He lives in the Las Vegas, popular actor. His only favorite thing, you know what? He's always ready to kiss. He's always ready to kiss. That's all. Okay. Now don't talk to other diseases. You know, everything is big, big for him. All the muscles. Okay. So he's a muscle guy. So you see organ swelling, big muscles he has. That means he has organomegaly, cardiomegaly, all the megaly part. And colon may becomes big. We call mega colon, mega esophagus, and cardiomegaly. All big, big muscles. Okay. That's okay. That's for another thing. But now let's see. It's a revision only. So Tom Cruise, because the disease name is called Trypanosoma cruzi. Tom Cruise, Trypanosoma cruzi. The disease name, Chagas disease. Chagas disease. Ready to kiss because the bug name is called redovate bug or kissing bug. Kissing bug. Redovate bug or kissing bug. Which is causing because your Vegas is in the America. So American sleeping sickness. American sleeping sickness. And also don't forget that sign, Romano sign. He's a romantic fellow, so he has a Romano sign. So these are some important questions they can ask you in the Tom Cruise. Okay, Tom Cruise. So what I'm to here, I've seen here Chagas. Chagas is Vegas. In Vegas, Tom Cruise lives and he's ready to kiss. Redwood bug. Redwood bug, which is also called as kissing bug. So who kisses? Tom Cruise, kissing bug. But the kissing disease is Epstein-Barr virus. That there, that's a Paul. Paul is kissing his girlfriend in the bar at age of 21. 21 because CD21 cells. Epstein-Barr virus, the previous one we discussed. Epstein-Barr virus favorite cell, favorite receptor is CD21. Okay, CD21 on the B cells. Favorite cell. Okay, so that's a different thing. So now, so we came to an idea. So you're not going to miss anything here. Okay, we discussed very well now. So in this parasite part, you're not going to make any mistake of these vectors if they ask. So A goes to 3, A3, B2. So A3, B is 2, B is A goes to, sorry, A3, B1, A3, B1, C4, write it. Okay, answer is 2. Okay, got it. So another good revision we had for another question. Now, let's go to another question. This is very important, very important. You can't go to exam without knowing the shape of the eggs. These are 4 important eggs frequently asked. You can see it has asked more than 20, 30 times. They must have asked it, either FMG, Neet, PG or Inicet. Okay, so now what is important here? We're going to do now. Look at this thing. Here I'm seeing a dumbbell shaped. I'm seeing a barrel or dumbbell. I'm saying a barrel or dumbbell shaped egg. So I always say when you go to gym and if you start a dumbbell, you have to try first. You have to try the dumbbell first. Try, okay? Try to. Don't just go to gym and say, oh, I can't do the exercise. It's too much for me. No. You always have to try, okay? You always have to try. You always have to try, okay? That's very, very important. Excuse me. Okay, so don't forget, okay, you have to try first. So dumbbell, so barrel or dumbbell shaped, and what you do when you break, try dumbbell, and also try to break the coconut. Okay, this is the clue I gave for this disease. So you already understood what I mean to say. Try means trichuria. What happened here? Rectal prolapse. Because of rectal prolapse, you have what? Coconut cake. They call it as the coconut cake rectum or whatever. Coconut rectum or coconut cake rectum. Okay, same thing. So you saw the egg was like this dumbbell. Okay, it's looking like a dumbbell or barbell. So try. Okay, so first one, you marked it correct. You can get one question. Look at this one, like this ugly shaped, you can see a little bit of ugly shaped overluted egg. Okay, like this two types. One is completely, in other one maybe the picture is not so clear. You see here is a space where there is a crescent space. You can see a crescent space, and you see the ovum. You see this is the space you're seeing, and also you're seeing a clear ovum inside. Here nothing. Here there is no ovum. It's just the coat. Only coat. Only coat you're seeing. Only the outer coat you're seeing. There is no any ovum inside. So this type of two types of egg. Okay, these are two types of egg. Okay, these two types of egg are ascaris eggs. Okay, so this one, the first one which you're seeing is basically non-fertilized. Non-fertilized means no ovum, no space, nothing. No. Everything is no. When you see something, when a space is positive, ovum is positive, this anything is positive, and also fertilized egg will float positive. So those things are fertilized eggs. These are fertilized egg of what? Ascaris. Fertilized egg of ascaris. Okay, you got it. So easy, no mistake. And ascaris, it's the most common, most common worm, you can say, most common nematodes or roundworm. Okay, causing a lot of malabsorption, obstruction, appendicitis, etc. Okay, not touching that. Okay, now what about this one? Look at this. This egg very much looks like a D shape. D, plano-convex. No, D is also called plano-convex. Plano-convex shaped egg here. And the moment you see, only I always say the child will cry. How the child says at night time? The child, because of perianal itching. Anal itching. Okay, I'm going to write anal itch. Perianal. Actually, it's perianal, not anal. Perianal itching. And child say what? Mama, dada. Mama, dada. Mama, because the drug of choice is mebendazole, which I'm talking now. Mebendazole. D for D-shaped egg. So this is a clear perianal itching. Child has perianal itching. Mama, dada is clear for which one? Enterobius, which is a pinworm infection. Repeatedly asked question. Pinworm infection. Enterobius infection. Okay, so you got it. So no any mistakes in that part. So enterobius you got. And enterobius, don't forget special swab. NIH swab. NIH swab is a frequently asked, or Scotch tape. Drug of choice, mebendazole. That's what I told. Mama, mebendazole. Dada, because D-shaped egg. The egg is D-shaped. So we call dada. Mama, dada. Dada, D-shaped egg. Mama, this thing. Perianal itching, NIH swab. That's it. Nothing will come from this. Okay. So fine. Next one. You see this egg. Whenever you see egg with lot of O like this. Okay. O. When you see lot of O, like this O inside the egg, when you see a lot of O, that is hookworm. So when you say hookworm, it is either ancylostoma or necator, or it is necator. Necator americanus. So these two are the hookworms. So it's a hookworm egg. So directly you're going to mark this as this ancylostoma. Very simple, right? So eggs, no mistake. This 4 egg, one is sure, guaranteed question. Okay, these are all 100% guaranteed question. If it doesn't come, it doesn't matter, but you should expect it, highly expected questions. Okay, that's all. In egg only, these are the 4 thing eggs you can see frequently asked in your exams. Okay, so first one is try egg, the trichoris trichoria. Other one is your ascaris egg. Second one, one is the unfertilized, and other one is fertilized egg. And the third one is your D-shaped or planar convex shaped egg, which is enterobase vermiculus, perianal itching, mama dada. And then the last one, you see a lot of ovulated. When the ovum has a lot of this O shape, this is basically the shape of this embryo only, ovum only. Okay, it's lobulated, so you see a lot of O shape. It looks like O. We simply say, for understanding. So like this with a clear space, if you see, that's a hookworm egg, which is Ancylostoma nicteria americanus. Okay, and you know that this is the most common cause of iron deficiency anemia. Okay, here hookworms are more common cause of anemia. Okay, so if you want to mark the answer, A goes to 4, B is 3, and your C is 2, and D is 1. Okay, fine. Okay, even if you don't know, you know it, so I'm just going down. Okay, fine. Next one. Which of the following statement is incorrect regarding strongyloides? Okay, strongyloides, all I want to know, before even go to the options or anything, just think only one thing. All I want you to remember strong means strong female only. Female, strong female. Females are always strong. You know that who is strong female? A strong female one who doesn't no need men. No need men. Okay, no need men. She can fertilize, produce baby herself. That is called parthenogenesis. Parthenogenesis. Second one, she gives egg, but egg hatches into larva immediately. Immediately, strong female, they give baby directly, without egg, directly they give the babies. Okay, directly baby, directly. Okay, egg is only for short, directly, immediately. So this is called ovoviviparous. It's a big name, ovoviviparous. And strong women are always like a current. They are like a current. So we call it as larva currents. They move very fast. Larva currents. Okay, larva currents. Don't forget. Strong women's next one, they are always hyper. Strong women's, we've seen some of these strong women, they're very hyper. So hyper because the infection they cause is called hyperinfection syndrome. Hyperinfection syndrome. Okay. So classic, these are the 4 points you should know for strongyloides. You never see egg because larva immediately hatch, and that larva is very like a current, it moves. And in stool also, you will see only larva. You will see in the stool also no eggs in the stool. Okay, and hyperinfection syndrome. Moreover, don't forget the secret of strong female, they eat ivy gourd. Ivy gourd is a type of bottle gourd. It's a type of that vegetable, only green color. Ivy gourd, you say, you can see it, bottle gourd, a small one. So that's the female strength. Short, finished. I told you all the clues now. You can easily answer now, right? So exhibit parthenogenesis. Yes, strong women have parthenogenesis. Correct option. Larva currents is fast moving, definitely, because I told strong women are like current, they go super fast. Current super fast. Okay, and then ivermectin, yes, I just told. Ivy gourd, they eat ivy gourd. Ivy gourd is I meant to say ivermectin. Ivy gourd is the secret of energy. The strong woman's secret of energy. Okay, right. Next one. And then comes your systemic strongyloides. Systemic strongyloides is infection seen in immunocompetent. No. This one, what I told you, hyperinfection syndrome. This strongyloides, systemic strongyloides is basically hyperinfection syndrome you call. Okay, it means repeated attack. You have repeated infection. Systemic infection especially affects the brain. So this is very common in HIV patient. HIV and also HTLV1. Okay, human T leukocyte virus. Okay, so that is more common than in HIV patient, you can see. So this is the wrong option. So this should be an immunocompromised, not immunocompetent, immunocompromised patient. Immunocompromised. It should be immunocompromised. That's all. So important about strongyloides. It feels tough for you, strongyloides? Not at all. Strongyloides means it is a strong lady story. Okay, strong lady, strong female story. Easy. Okay, that's all. So now next one, a 40-year-old male presents with the 40-year-old male presents with the abdominal pain for year, not associated with vomiting and jaundice, just abdominal pain. No history of fever and weight loss, nothing. Okay, abdominal ultrasound suggests a cystic swelling in the liver, just abdominal pain and swelling in the liver, and then CPC shows eosinophilia. So there is a parasite. Eosinophilia is given, so parasite. Then a cyst was excised and sent to microbiology, and these structures were seen. So these are the structures they have given. Okay, these are the structures you're seeing, which is the false statement. First of all, look at the clue here. Abdominal pain and cystic swelling, cyst. So for me, cyst and this eosinophilia gives me clue it is a parasite. A parasite with cyst in the liver. They say cyst in the liver. That is only possibility hydatid cyst. A cyst in the liver means it is hydatid cyst. A parasite. Two clues is enough. A parasite, a cyst in the liver is clearly hydatid cyst. It can't be anything else. Okay, mostly with the eosinophilia rise. So eosinophilia rises in parasite or allergy. So we're not going to talk about the allergy here. So that's what. Okay. So now eosinophilia. Now what happened? Microscopic in this structure. You see this structures what you're seeing. They're looking like this. They're looking like a hooklet. So hooklet structure. So basically the answer is hydatid cyst. So it's the hydatid cyst. Hydatid cyst. We are going to be a short revision now. So you know hydatid cyst. The first one. The causative agent is Echinococcus granulosus. Absolutely correct. The dog is, which is a false statement they asked. Okay, false. Dog is intermediate. That's a problem. Dog is a definite host. Dog is a definite host. Definite host. Okay. I'll come there before going to dog. So this is the wrong answer you found. Cassoni testis positive, absolutely yes, and repeated question. Then this is a type 1 hypersensitivity reaction. Is another repeated Fmge question and also Neet PG. A type 1 hypersensitivity reaction. Okay, because an allergic hydrated fluid is an allergic fluid. Okay, and albendazole reduces definitely yes. Apart from surgery plus albendazole is the treatment of choice. You know that. Okay, now what happened when you talk about the definite host? There are three exceptions where human is not definite host. Definite host is not human. Not human. Human is intermediate host in three diseases. What are three diseases? HMT. H for your hydatid cyst. M for your malaria. T for your toxoplasma. T for your toxoplasma. HMT watch. If you remember in our daddy's time, our parents' time, olden time before 20-30 years, HMT watch company is very popular. So remember like that. Okay. So where man is not definite host. So in hydatid, the definite host is dog. For malaria, you know, it is the female Anopheles mosquito. Female Anopheles mosquito. Anopheles mosquito. And then for toxoplasma, you know it is the cat. Pregnant ladies and HIV patient, it causes infection. So of course, your answer is dog is a definite host. It's a simple question where they can twist you. And don't forget this classic hookworms you can see inside the liver, inside the cyst. Okay, hydatid, inside the hydatid cyst, you have that hydatid sand. And you know in ultrasound also there is this sign water lily appearance. Water lily. Okay, and then snowstorm, sometimes they call it a snowstorm, sometimes they also call honeycomb appearance. Honeycomb. This all are classic for your hydatid cyst, and the treatment is, you know, you have to do either you remove the cyst or you do what technique treatment? Pair technique. Percutaneous aspiration, inspiration, and re-aspiration. Okay, with a different type of cetrimide or alcohol or normal saline you have to use and clean the area. Okay, that's it. So that's treatment part. Okay, so we're done with echinococcus. Very good. We are now very good with our echinococcus also over, which you can revise it now very well. Okay. Now a 10-year, next question. A 10-year Tibetan girl presented with the headache, mild seizure and vomiting. Okay, something with the brain. So mild seizure, vomiting has come. MRI illustrated a lots of intracranial cystic lesions. So there were some cysts. This is the cyst. They are seeing the cyst. Okay. This cyst itself, first, the moment I saw itself, it gives me a clue. Starry sky appearance. Starry sky, full of stars in the sky. Starry sky appearance in the MRI or CT. First clue. Okay. I think it makes you sense. I think you guys are going towards thinking of tinea solium, then that is correct. If you're thinking about cysticercosis, then it is correct. Okay. So if that is correct, so it's going to that. Let's see what is asked. No any obvious extracranial lesions. Okay, fine. And then what's the next clue for me? Serum IgG antibodies against cysticercus positive. That's all. So what do you want? They already gave you cysticercae means itself it is tinea solium or saginata, but usually here it is tinea solium. So this disease is something related with the tinea solium, and it is clearly brain. So it is neurocysticercosis. Neurocysticercosis. Okay. So when you talk about cysticercosis It is caused by usually Taenia solium only. It's caused by Taenia solium, especially which form? The egg form, not the larva form, the egg form. The egg form, due to autoinfection, it goes inside and affects different parts of the body. But classically, it affects what? It affects the brain. Brain is the most common part to be affected. Followed by brain is a subcutaneous tissue. Don't forget, it's a subcutaneous tissue. Then only it's the skeletal muscles. Skeletal muscles and the eye, etc., comes after this only. Okay, so brain is second. Most common cause of units, most common cause of seizure. Okay, neurocysticercosis, Taenia solium is the most common cause of, most common CNS parasitic infection, also most common cause of seizure. Okay, in children overall. Okay, fine. Now let's see. X is the infected state. Definitely correct. They asked you what's the false statement. Antiparasitic drugs and steroid combination used for treatment. Of course, yes. You're going to give antiparasitic albendazole or praziquantel. Combination with the steroid only decreases the site of inflammation in the brain and decreases. Okay, that is main thing. Okay. What about subcutaneous neurocysticercosis is the most common form than neuro? No, that is wrong. You just told brain. When you talk about cysticercosis, the most common one is neurocysticercosis only. So that is brain. Okay, so this is a wrong statement. So this is the answer. And autoinfection cause definitely yes. Okay, autoinfection is the main reason. This Taenia solium due to autoinfection only, it goes into the brain and causes all the problem. Okay, so autoinfection is also correct here. Okay, so then your and C is the option. Okay, so something written here. So this is a pig usually. Here this is that show, no, pig show. Okay, the one of the popular one, Peppa the pig. You know that show. Okay, children's favorite. You see what they're seeing? They're looking at the stars. They're looking at the stars. So I want to say stars. The MRI starry sky appearance is a classic sign. It can be a radiology question for you. You see the starry sky appearance. So that is definitely your or neurocysticercosis. Though there are some exceptions, but then yeah, this is very important. Okay, so don't forget it. So this is for your neurocysticercosis. Okay, so you're done with this. And you know, it's of course, pork is the intermediate host. Man is definite host, and pork, that is pig, is the intermediate host. Okay, fine. So tapeworm. Now, next question. An AIDS patient, whenever you see a big question, don't get panicked. The big questions are the easiest questions. The small questions you make mistake, in big questions you have a lot of clues. Okay, so excuse me. Okay, right. So now, yeah. A AIDS patient comes to emergency department after suffering a grand mal seizure. So again, an AIDS patient with seizure here. The man informs the emergency patient that he has suffered persistent headache is there for past few weeks, but denies any sensory problem weakness. So persistent headache is the first problem. Fearing brain tumor. So he thought brain tumor. He came to ET physician, orders a CT scan. See, the CT scan showed several ring enhancing masses in the brain. Several ring enhancing. Ring enhancing is first clue. He has a person head. AIDS patient is again one clue. Okay. And then physician confirms the suspicion that he learns the patient has many cats. Cat is enough. So my brain will think definitely what you have to think, toxoplasma. If it is dog, you're going to think the hereditary cyst. Okay, that is your echinococcus granulosus. But here it is many. It is here they asked about the cat's given clue. But so it is AIDS patient. Okay, and it's the AIDS patient. So let's see. So in brain biopsy, it showed a crescent shape tachyzoid, trophozoid. This is the one. What is it? You're seeing here. No, these are the tachyzoids. Identify the causative agent. Definitely, it is toxoplasmosis. So no doubt, right? So your answer is toxoplasmosis. Ring enhancing. Ideally, see, whenever you say toxoplasma, usually it affects two people. Okay, two. One is your HIV patient. Other one, it can affect the pregnant ladies. Okay, right? So in HIV patient, CD4 count less than 200. That's a classic sign. It's not only here, even a cryptococcus, toxoplasma pneumocystis. For CD4 less than 200, it can affect. In pregnancy, nothing. In pregnancy, because see, in both the cases, the reason is the cat. Cat is the definite host. Cat is the definite host. Definite host, especially due to intake of the oocyst. There are other stages, but oocyst is very common one. Oocyst intake, it goes inside. So now here, because CD4 count, it usually affects the brain. So patient get encephalitis. Encephalitis. In pregnancy, multiple things are possible. The usually abortion in children. When the pregnancy gets, the child get aborted, or the child can get what? Congenital toxoplasmosis. In congenital toxoplasmosis, you know the classic sign. What they have? Intracerebral calcification. Intracerebral calcification plus the child can have either micro or macrocephaly. Macrocephaly was your previous FMG question. Don't forget. Also Neet PG. Macrocephaly. So only either micro or macro, but macro is very characteristic only in toxoplasma. Only toxoplasma. And I always told you to remember as the pregnant lady's name. The pregnant lady's name is Sabina. The pregnant lady's name is called Sabina. Sabina is pregnant because there is one gold standard test for this one, congenital Sabin-Feldman test. Sabin-Feldman test. Sabin-Feldman test, we told. Here you're detecting IgG. Okay, it's a gold standard. IgM is divided by LSA, IgG. So it's a gold standard. So Sabina is a pregnant lady who's getting toxoplasmosis. So it gives to a child. Okay, so intracranial calcification, macrocephaly is very important characteristic feature. You can't forget. Okay, so that's what I'm stressing here. So that's it. And in both the cases, doesn't matter, in CT scan, you will see ring enhancing lesion. Ring enhancing lesion. So both HIV or in this thing, the brain CT of the brain CT, you're going to see ring enhancing lesions. So it's a brain. If you see a lot of that picture might be there in behind, I'll show you later. So you see a lot of ring enhancing lesions. Okay. It's very characteristic here. Okay, right? So this is the answer. So toxoplasma gondii finished. Okay, so this thing. Tinea solium neurocyst, echinococcal converse, we already highlighted cyst. This thing. Tetanus virus affects the muscles. So no anything. So toxoplasma gondii is an easy answer. You can't make mistake. Okay, fine. Very good. So we revise our toxoplasma also. Okay, good. Now match the following. Next one. So again, another expected picture. Now these are blood parasite. Okay, some blood parasite. What are important here? So in the first picture, what I've given is, this is a monocyte or macrophage. Okay, this is a macrophage this is a macrophage. You're seeing a macrophage. Inside the macrophage, you're seeing this beautiful like Dia-like appearance. They call Dia, which is an amastigote form. Amastigote diagnostic form, amastigote form, or LD bodies. We call LD bodies. So LD bodies means it's a what is it structs. You know that is your Leishmania donovani. So Leishmania donovani. Directly you can mark Leishmania donovani. That is the characteristic sign. Okay, that is basically the kala azar. Kala azar or visceral leishmaniasis. Visceral leishmaniasis. Important is RK39 antigen test positive, first one. Also Montenegro skin test. Montenegro skin test. Okay, skin test. It's a Nigra, no? Montenegro skin test. Skin test. Okay. These are some important tests you should know. That's all. Leishmania donovani. Okay, fine. Which is Kala-Azar Pesara. Look at this one. Here, if you see clearly, here you're seeing this beautiful, what you're seeing? Cross. You're seeing a cross like this. Okay. So whenever you see a cross, we always say a beautiful child baby is wearing a cross. So what I'm talking here, babesiosis. A baby is wearing a cross. That is what's called Maltese cross. That is called Maltese cross. So Maltese cross, this is LD body amastigote for your leishmania. Maltese cross and baby, I gave you clue. Babies always tick. Babies always tick. Okay, baby means always tick. So it's a heart tick, caused by heart tick, baby Maltese cross is babesiosis, which is the symptoms are very much similar to malaria. Only thing is that you will see a cross like picture. If you get a cross like this, you see everywhere there's a cross. When you see a cross, then that is your babesia. Babesia. Okay, babesiosis. Okay, now look at this one. I'm seeing a beautiful banana. I'm seeing a beautiful banana. I'm seeing. So you know, whenever say banana, who likes banana so much? Our Mao, Chinese Mao, the Chinese Mao, dangerous Chinese Mao. So the word dangerous Chinese Mao comes means itself, you know, the dangerous malaria is your falciparum. Falciparum. Okay, falciparum. And also don't forget, in fact, the most dangerous one, of course, the most dangerous malaria is your falciparum. You know that. Apart from that, don't forget, there's this a cold form, a cold in blood. Also, you see a cold form, or it's a headphone. Headphone, they call it the headphone form. It looks like this. On the RBC, you'll see like this. So those things. Okay, another clue. Here, it is also, this is a gametocyte. Basically, this is what you're seeing is a gametocyte. Gametocyte of ovale. Oh, banana shaped, banana shaped gametocyte is your falciparum. What about this round shaped, oval shaped gametocyte? It will be your vivax. Why I say Mao? Because you see something called Moyer rods. Moyer rods are classic for your falciparum. And when I say Vivax, Vivek's girlfriend are two. One is Schaffner's daughter, Schaffner. Other one is which antigen helps in the entry? Duffy. Two girls are Vivek's girlfriend, Schaffner's daughter and Duffy antigen. Okay, if they ask, it's been a while they didn't ask. If they ask, okay, so we're very clear now. So some of the diagnostic parts we are happy. And then babesiosis is transmitted by tick. Okay, others are mosquito. Leishmania donovani, you know, it is a sandfly. Leishmania donovani is a sandfly. Phlebotomous or sandfly or phlebotomous was another question asked in another exam. Phlebotomous. Okay, and of course, Vivax and malaria, you know, female anopheles mosquito. We already discussed. Okay, so it's fine. So answer should be your A goes with 3, A goes with 3, and then B with 4, B with A 3 and B 4, C 2 and D 1. Right. Okay, correct. Okay, so very good. So we finished the multiply this parasite also. Another, please expect this question. So nowadays outbreak is happening on this question. So you know this one also. You can see the picture also if you find it's fine. Otherwise, no problem. Let's go to the question first. Okay. So, it starts with a 17-year-old male. Okay, just male. Doesn't age doesn't matter. A 24-hour history of severe headache, vomiting, neck rigidity, fever. So basically, he's having meningitis. So basically, the first symptom shows that he's a meningitis. Second one is a recent camping trip included river rafting. River MRI showed some basal meningeal enhancement. Okay, fine. And LF was performed. Here, glucose was less than 20. Protein was increased and neutrophils were seen. Neutrophils in the CSF, okay. And then wet mount revealed this picture below. This picture is shown, and the patient was given multiple antibiotics, antiviral, antifungal, even steroid. After 2 days present ED, patient. However, 2 days after presentation to the ED, patient goes to coma and died within 3 days. That's all. Okay, died within 3 days. You already know the answer, I know, but still, without going to the options only, we will try to solve it. So first one, the man says it's a meningitis. First of all, there's a symptom of meningitis. Meningitis. Okay, it looks like severe meningitis, severe headache, vomiting is there. Second one, history of water source is there. So swimming pool or water source is there. An MRI is fine. So again, it is reconfirming. All these things are confirmed. Neutrophil leukocytosis, protein level high. These are These are saying that there is some infection is positive. Some infection is positive either because you see glucose is like protein high means it can be bacteria or it can be fungal or it can be even your parasite. Some parasite can be. Okay. So one of these infections. Fine. Now they said after wet mount was done, the picture was given here. Okay. This picture, even if you don't know, also doesn't matter. Just where some amoeba is there. So 2 days after, patient goes to coma and died within 3 days. So prognosis is very bad. Bad prognosis. So clue is given already. River, severe meningitis, not normal meningitis, severe meningitis. Bad prognosis with this picture. This picture is basically Naegleria fowleria. Naegleria fowleria. Okay. So this is a new highly expected question. Please expect it. Now Naegleria fowleria. How to remember? We already told that when Naegleria comes, Naegleria is Nigel. Nigel is a very popular US name, Nigel, with his girlfriend Pamela Anderson. Pammy, I call her Pammy. Pamela Anderson. Pamela Anderson, everyone knows her. She's such a hot girl, actress also. Okay, boys know her very well. So Pamela Anderson. So why did I say Pamela Anderson? And I told the story. Both of them are going to swim in the warm water. They're swimming in the warm, okay, sort of warm water, lukewarm water. And suddenly, what happened? He died. The boyfriend died because of this disease. Okay. So what I mean to say here, Naegleria fowleria. Pamela Anderson, the word PAM is very, very important because the disease name is called primary. So one second. Yeah, here it is. Sorry, this is one I've written here only picture. So this is Nigel. I'm writing it down. This is our Pammy. Pamela Anderson. Okay, Pammy. So P for primary amoebic meningoencephalitis. So this combination of meningitis and encephalitis will come only for Naegleria fowleria. You're not going to make mistake in that. Okay. So now what happened? This is the worst problem because it enters. What happened? This amoeba is also called brine eating amoeba. You call it as the brine eating amoeba. Brine eating, this Naegleria foliaris is a brine eating amoeba, which enters into the nose, then directly to the olfactory. It catches the olfactory nerve and then goes to the brain, and what it causes? Meningoencephalitis. Meningoencephalitis. Very bad. Patient dies. That's the story. Okay. So now let's see. So answer is given. Naegleria fowleria. Correct. Then, sir, why not Acanthamoeba? Also, it's a free-living amoeba. Acanthamoeba, Naegleria, both are free-living amoeba. Why not Acanthamoeba? Acanthamoeba, I told acorn. Acorn is a gay. We are making gay for our understanding only. Okay, it's not real gay. Gay. Okay, Gay. Gay. Okay, gay. GAA. So this is granulomatous amoebic encephalitis. So here you see only encephalitis, and it's very chronic, not that bad compared to Naegleria. Naegleria, suddenly it comes and patient finished. You see a lot of death happened in Bangalore and Kerala, particularly in Kerala. A lot of young people died, especially there are a lot of river sources, water sources. So the government is saying that the healthcare is saying please avoid all those things. Okay, so this is the reason. So your Naegleria failure, you're clear now. Okay. Fine, right? Acanthamoeba is another one which causing granulomatous amoebic encephalitis, and acanthamoeba also called contact keratitis, contact lens. Okay, keratitis. So don't forget that also. Okay, right. Now, next question. Right, acanthamoeba. Also, don't forget acanthamoeba is for contact. I'm going to write acanthamoeba also plus this. It's also causing contact lens keratitis, mainly contact lens keratitis. That is okay. And the picture is here already for your Naegleria. It's looking like this one side, and one side you see a lot of cilia-like structure, and it's dangerous one. Okay, that's all. This much you should know. Fine. Now, next question. A 16-year-old girl complains of abdominal vaginal discharge. Okay, now this is another very important expected question. Vaginal discharge, girl vaginal discharge with itching, tenderness, burning sensation. Okay, so that's a vaginitis. On examination, vulva and the vaginal erythema was there. Colpitus macularis. When you say colpitus macularis, strawberry vagina. Strawberry vagina is enough. You already revised 1,000 times. It is Trichomonas vaginalis. Trisha. Trichomonas, Trisha. Trisha's favorite fruit, strawberry. That we remembered. Okay. So now wet mouth. On wet mouth examination, you see this picture was given. And then they asked, wet mount examination, this picture was given. And what additional symptom you would expect? Okay, so first of all, let's see this picture. Here you can see a single nucleus only. In each side, you can see only single. It's like this. It's like this. And then, of course, there are a lot of anterior, four nucleus, and posterior one nucleus and all. There's only one. Okay, so this one shows single nucleus, number one. And there is only trophozoite stage, no cyst. Only trophozoite stage, no cyst. That's what always. So I'm saying now single, only trophozoite, and one more thing. What they've given? Strawberry vagina or cervix, vagina or cervix. This all who is single, and who eats always strawberry? Our Trisha. Okay, Trisha. Also, wait 1 minute. Trisha, because the answer is Trichomonas vaginalis. Answer is Trichomonas vaginalis. Okay, vaginalis. All are important question. You have single nucleus in the trophozoite, then that is only trophozoite seen. There is no cystage, only trophozoite. So these are the trophozoite you're seeing here. And don't forget, Trisha likes also green. She eats a lot of greens, okay, because the color of discharge is greenish discharge, okay, and also profuse. It's profuse, okay, profuse greenish discharge. Excuse me. Okay, so now let's go to the options. What type of discharges are given here? Look at the first condition. It's a bloody, foul-smelling vaginal discharge. That is not. This is usually in trauma or any other rape cases, forensic. For them, they talk about it. Okay. Profuse, frothy vaginal. Exactly. That is the correct answer. That is a classic trichomonas vaginalis discharge. Profuse, frothy. Sometimes smelling, but usually profuse and frothy. Sometimes they can give you green also. Green is also correct. Okay. What about this thick white cottage? This one, anything cottage, cheesy, it comes C for cottage or cheese or milky, whatever it is, candida. That is candida. Okay, candidal discharge where pH is, less than 4.5 is very characteristic, and you will see what? Budding yeast cells. Budding yeast cells, BYC, you will see budding yeast cells, characteristic for candidal. No mistakes in that. This one, thin gray fishy. Okay, gray fishy. So this type of gray is BV, bacterial vaginosis. Bacterial vaginosis. Classic. Okay, so no mistake. One question, sure you'll get it. Okay, fine. So now you see, this is a Trisha. Beautiful diamond because diamond media. Second one, you see her eyelash is very beautiful because the other name is called cystine, eyelash, lash, cystine media. So two important media. Then strawberry, her favorite food is strawberry plus greens. She eats a lot of greens. Okay. So green leaves you're seeing. So green color discharge and strawberry vagina. So this is typical strawberry vagina. Okay. Strawberry vagina. That's it. Okay. Some important points. Okay. And of course, motility, very rarely they ask. T for Trisha, T for twitching motility. Twitching. Twitching motility. That's it. Okay. So you're clear now. So Trisha is single always. Okay. Only trophocyte stage and only one nucleus. Only trophocyte, only nucleus. Okay. That's all. Now let's go to our next question. Another, by seeing the picture only, you should know this is a highly expected question. We have selected only the questions where examiners like to pull your legs. Okay. Excuse me. Okay. Now next one. Look at this question. A HIV patient with CD4 count less than 50. Okay, less than 50. Okay, doesn't matter. Presence with persistent diarrhea. Microscopic examination of stool is given. An acid fast parasite of 4 to 6 micron was given. Okay, correct statement. So, this itself, okay, so look at the picture. Before going to the picture, you know that when you talk about acid fast parasite, we're talking about the three important parasites. When you talk about the acid fast, or we call so coccidian. They call it as coccidian parasites. Okay. So one is your crypto. We call three sisters. The smaller sister is called cryptosporidium. The middle sister is called cyclospora. And the bigger sister is called, usually we call isospora. Nowadays we call it as cystoisospora. Okay, so don't confuse, both are correct. Cystoisospora, cyclospora. Okay, so three important things are very important. So all of them very common in which patient? HIV patient. In HIV patient, they all are, though the most common one is the most common one is your cryptosporidium, most common, but they all are most common cause of diarrhea in HIV patient. In dire HIV patient, this only have to think. Prognosis is really bad. Okay, treatment will we have drugs, but still, it's it's difficult. Sometimes it's very difficult to treat. Okay, cryptosporidium size is important. Why acid first? Always we say acid first because when you're using the Zn, especially Zn, that is acid first stain, you use how much? 1% H2SO4. Especially when you're using 1% H2SO4, it is also called quinone stain. Quinone, Zn, acid fast, all are same only. Don't please mix it. Okay, this is all are acid fast. So you'll get red color structures like this. Okay, so before going to structure, I'm going to write this here. Cryptosporidium, the size is 4 to 6 micron. Okay, and when you double it, it will become 8 to 12 micron. Again, when you double it, 24 to 36 micron. Very important question. Usually, it is frequently asked. One of the size is the main clue for you. First one. Second one, it is all are acid fast, fine. Autofluorescence. There is something called autofluorescence. Autofluorescence, crypto small sister is not negative, but other two are positive. Okay, fine. Next one. This is on all causes of diarrhea. We told HIV, that's common, and all are acid fast. That's okay. Okay. Now the last one is treatment part. Treatment, we told crypto means it's a cryptocurrency. The thing that comes to mind is cryptocurrency. Whenever you think about cryptocurrency, whom do you think? You're going to think about the Nita Ambani. So Nita Ambani, cryptocurrency means it's of Nita. Nita Ambani. So nitazoxanide. Nitazoxanide. Whereas your other two sisters, the big small and the big sister, they are what? Cotrimoxazole. Cotrimoxazole. So when you see the picture, this big one oval shape you're seeing is the isospora, cystoisospora, big sister, isospora. Okay, revision, very important. You will definitely have this question. And something like this, little bit smaller than that is your cyclospora. Cyclospora. Okay, cyclospora. Then the picture which you see here, see the tiny small one, they are cryptosporidium. Cryptosporidium. So we have done a very good revision. You're not going to make any mistakes. Okay. So only when you only difference is fluorescence, you see only sisters. Spora, big sisters. Okay, spora, not the sporidium. Spora sisters, they have fluorescence, means they can shine automatically. Okay, autofluorescence. Okay, so that is, otherwise not. Okay, now look at this. The infection, what is the, they asked the correct statement. So here the infection is usually self-resolving and does not require treatment. Absolutely not. You have to treat. Very dangerous. Patient can have severe diarrhea and can go very bad consequences. Okay, so you have to do it. Okay. What about, can be treated with cotrimoxazole and be resolved in 2 to 4 days? Not cotrimoxazole, because it's a cryptosporidium. Cotri is not. We have nitazoxanide is the effective drug, not the cotrimoxazole. Okay, might help, but not that extent. Okay, good. Okay, not that good. Infections treated with anti-TB, it's not a TB. Of course, you know, when you talk about Mycobacterium TB, that is acid fast only. That is acid. We call AFB, acid fast bacilli. But there we are using how much? You are using 25% H2SO4, and it's totally different. That is not like this. That's a bacteria. So you don't, this is not confused with this too. Okay, so it's out. Nitazoxanide is given, and the infection is usually difficult to control. I told you, correct. Nitazoxanide drug of choice, and this treatment is usually very difficult. At one shot, it will not go. They have to repeat the treatment again and again. Then only it will give some treatment can be efficient. Okay. So we are clear with an acid pattern. Please expect a question from here every year. They are not missing these two. Okay. Every point I have told here is a question. Okay, so you are thorough with it. Now we are going to the next one, mycology part. So we're done successfully. We finished a parasitology, all the important questions, topics which we should expect. So now let's go to mycology part. In mycology, first one itself, I'm seeing some dermatophytes here. I'm seeing beautiful dermatoid feature. Again, classic repeated question for your FMG Neet PG. Okay, so by this picture only you see, first, for my first picture shows, it looks like a club for me. The picture looks like this, no? I'm going to change the color. Yeah. So this is like this. So this is called club shaped. So I'm seeing a club shaped microconidia. All what I'm seeing here are macroconidias. Macroconidia picture. The macroconidia which is club shaped. Okay, club shaped macroconidia. Here I'm seeing what? A beautiful pencil shaped. Pencil shaped macroconidia. Pencil shaped macroconidia. And here I'm seeing a beautiful spindle shaped macroconidia. Spindle shaped macroconidia. Okay. And then the last picture. Wow, what a delicious. I'm seeing a spaghetti and meatball. I'm seeing. Okay. You see here, I'm seeing a lot of spaghetti and meatball. Spaghetti plus meatball. Meatball. Sometimes in Indian term we call it as the banana grapes. Banana grapes. Banana grapes. Banana grapes. Okay, so spaghetti and banana grapes appearance you are seeing. Okay, fine. So now you can see spaghetti. So now you're going to tell me the clues. We have repeated many times before. Even students who don't know, it's very easy. Club. Always remember the owner of a club in South India, at least in South India, Andhra or in Tamil Nadu, Kerala. The owner of the club is always named as Ebenezer. Ebenezer, they call Ebi, they call huge guys. You know, they can fight well. So they are the owners of the clubs. Okay, first one, first clue. Second one, Ebi. Okay, pencil. Always, you know, you have to try to write with a pencil. Try to write in a pencil. First, you draw with a pencil or write with a pencil. Don't directly go to pen. Okay, try. I gave you clue. Spindle. Who's a spindle? Spindle, the name itself has microsporidium. Microsporidium. Okay, fine. Got the clue. And you know who is the one who is spaghetti, meatball, even the, I'm going to write here, fried egg. Fried egg with olive oil. Fried egg with olive oil. Olive oil. So you know who is that favorite girl who likes to eat everything? We call her as the super pity mala. Super pity mala. Okay, mala. I gave you clue. She is that foodie with that picture. This is the girl. She is that super mala. Our super mala girl. Okay, she's enjoying her what? Spaghetti and meat and the olive oil. I mean, this is a sabrodextrose agar with this clue. Actually, sabrodextrose agar with olive oil. You get fried egg colonies. Okay, this is not the exact picture. This is for understanding. So saprotextrography with olive oil only, this girl grows. Okay, she's a fatty girl. She likes a lot of fat, lipophilic. So we know the olive oil fried egg appearance. Okay, so fine. Now that's a clue. So we know that Ebenezer is Ebenezer. That is basically, I'm going to write it here. Epidermophyton. This is epidermophyton. Epidermophyton. This is what I'm seeing here. Trichophyton. Trichophyton. Okay, trichophyton. Okay, this one microsporidium. Microsporidium. Okay, microsporidium. That's it. Now, this one Malassezia furfur. Malassezia furfur, which causes pityriasis versicolor. Okay, so first three are dermatophytes. So now epidermophyton, you know they affect different parts. First of all, let's go with tri. The name itself says tri. So it affects all your skin, hair, and nail. So this one affects the skin, hair, and nail. Anyway, they'll ask you a question. Anyway, I'm taking in a little bit different way so that you will not forget it. Okay. So that's what I'm putting it. Okay. So trichophyton 3, skin, hair, and nail are affected. Very good. Epidermophyton, I put it a capital N, one reason because everywhere skin is there. Skin is definitely affected in all the parts. Okay, because we talk about dermatophytes means skin only. So which part? So here skin, and because N is there, nail. So your answer should go down to your last option here. Okay, here skin and nail is affected. What about your microsporon? Microsporon, nowadays we say micro hair. Micro hair. Everybody's hair nowadays very small, no? Micro hair. So skin and hair, microsporidium. Another question, important question. The last one, mala. Mala has, you know, the main clinical feature of mala is hypo. You see hypo like this, hypopigmented, mildly itching or non-pruritic. Okay, non-pruritic or mildly pruritic rash. So that would be your this one, 3. Okay, so non-pruritic hypopigmented macules are catastrophic. Finished. We have nicely revised this entire dermatophytes, which is superficial infections. Okay, so one is Pityriasis versicolor, other 3 dermatophytes are thorough now. Whatever shape, whatever they're going to ask, you're not going to make any mistakes. Okay, very good. So you know already, I don't even have to mark it. So A comes, I'm sorry. A goes to 4. A4, B1, this one, C2 and 3. Okay, fine. Now, next one, another one. Again in mycology, another. Again, classic question. You can't skip this. You have a definite picture is there. That's what I've made this picture. Diagram. Micro, you expect minimum 10 diagrams. Okay, 10 pictures. Image-based question is mandatory. It will come. You can't skip. Okay, nowadays it's becoming excess. So it's good for you. So you don't forget. So now what you have to think, you don't have to try or struggle. Just make some clues. So look here. I am seeing a beautiful, what I'm seeing here, paintbrush. I'm seeing a paintbrush, or I'm seeing a broomstick here. Broomstick. First one, first picture. Second one, you guys can guess also. I'll also explain. Here I'm seeing a beautiful like this. This is called tuberculate. It's like a tuberculate. No, so tuberculate macroconidia. Macroconidia. Tuberculate macroconidia. I'm saying first. Here I'm seeing beautiful rectangular rectangular arthrospore. You see, I'm seeing rectangular arthrospore. Okay. Next one, I'm seeing a beautiful ball, you know, like this, what you call ping pong ball. Crushed ping pong ball. You also call it as crushed ping pong ball. You already got the clue. I don't even have to tell. But yes, no problem. We'll mark now. So paintbrush or broomstick, you know, I always said that. Remember our South Indian actor Ajit. We call Talai. We call it as Talai. Talai is our Ajit. Talai Ajit. He helps his wife Shalini with paintbrush, his children with paintbrush painting, and wife with a broomstick. And of course, his favorite animal is bamboo rat. We know that very well. Bamboo rat. Okay. So answer is Talai. You know that every pen in Tamil is girls. Every girls love Talai so much. Pen. So what I mean to say, Thalai is Thalaromyces or pen, I told penicillin. Penicillium. Okay, penicillium and Thalaromyces are same only. So this picture exactly goes to your Thalaromyces. Okay, very simple. Fine. Tuberculate. Tuberculate, somewhat the name sounds like TB, no? TB, TB, TB. So which is the disease exactly mimics TB? These are all dimorphic fungi. All of this, what you're seeing here are dimorphic fungi. Dimorphic fungi. Okay, these are dimorphic fungi means they have both yeast form and the hyphae form. The shortcut for dimorphic feature what I gave is that hit, blast, cock, paracock. Paracoc. Hit for histoplasma, blastomycosis, coccidiosis, paracoccidiosis, and spot and pen. Spot and pen. Pen is penicillium, spot sporothricus. Okay, so so the word TB comes. The disease that mimics very much like a TB is your histoplasma. So your answer is histoplasma. Histoplasma. Okay, which is very much the disease is similar to TB. TB, you know very well. And also the budding yeast cells is called tiny budding yeast cells. We call tiny budding yeast cells with, okay, tiny budding, narrow budding yeast cells, you can say. Okay, it's very small, tiny. Inside the macrophage, you can say intracellular, that's the question also. Okay, intracellular, tiny budding yeast cells. Okay, fine. Arthur. Arthrospore means if I told Arthur, what is the name of that cock? Arthur cock. We call it as Arthur cock. The cock that is the hen's husband cock. We said that where it is, you saw on the picture, it was going through the valley, it is going to the desert, valley to the desert. So that is the disease is basically valley fever, desert rheumatism caused by coccidiosis. So cock valley, the Arthur cock, coccidiosis. So cock means coccidiosis. Got it. Very simple. You don't have to use your brain and waste your time in unnecessary things. Just this enough. Ping pong, crushed ping pong ball. Oops, I see PCP, crushed ping pong ball. PCP. Oh my God, already I got a clue. I don't even have to think anything. I put it pink crushed ball and I'm getting PCP. What is PCP? Pneumocystis carni pneumoniae. Pneumocystis carni pneumoniae. That's it. So you know that pneumocystic carni, usually when the CD4 in HIV patient, when the CD4 count more less than 200, the patient gets typical, plasma cell pneumonia. Plasma cell pneumonia. Oops, again I'm getting PCP here. Oh my God. See, everything is PCP. The parasite name itself is PCP, pneumocystis carinii pneumoniae, and I see ping pong ball PCP, and I'm seeing plasma cell PCP. Oh my God, so easy. And the treatment also, C for cotrimoxazole was another FMG question. And Neet PG also, cotrimoxazole. Very simple. So you don't have to struggle at all. Everything God has given you, you just don't have to open your eyes and see and mark it. That's it. Okay. So micro becomes super easy for you. So another big revision is done for you. The dimorphic, most of them are done. Okay. So yeah, it's like A is 2, A to B4. A to B4. Yes. Option B. Okay. Very simple. So don't make mistake in these questions. Okay. Next one. Another repeated question also. Here sort of mixed here. So here I'm seeing exactly, you see the picture? I'm seeing this tiny budding yeast cells, intracellular, tiny budding yeast cells. What I'm seeing inside, all these things, what I'm seeing inside, whatever you're seeing inside, all this tiny budding yeast cells, okay? Narrow, tiny budding yeast cells, intracellular, narrow budding yeast cells, okay? So that is very characteristic yeast form of your histoplasmosis. Either the mold form we saw before, it was a tuberculate. Otherwise, you this tiny budding yeast cell histoplasmosis. Okay, histoplasmosis. Next one, look at this. Wow, this looks so beautiful. It looks like something like a figure of 8. So because it's like a figure of 8, why can't I make it like this B? Almost looking same. So this is a broad-based budding yeast. So broad, the base is broad. So broad-based. This one you call narrow based. Histoplasma you call narrow based. They are very tiny and narrow, no? You see like this, very narrow. But here it is broad based. So broad based budding yeast cell. So B for blastomyces. I don't even have to think too much. Blastomyces, that's it. Very simple. No, easy. Now, look at this. This is a spherules. And I told you already this Arthur cock, no? I told you this Arthur cock, coccidiosis Arthur cock. It's going to desert, through the valley, it's going to the desert. And what does it do, this cock? It is very hungry. This cock is very hungry, So it will eat a bowl full of spores. A bowl full of spores, this spore. A bowl full of spores. So you got what? Cock. So who is eating the cock? Who is eating this bowl? The cock is eating bowl of spears. So it is Coccidiomycosis. Coccidiomycosis. Very simple. Okay. There the picture was rectangular arthrospore. Arthur cock. The name is Arthur cock. It's going to the valley, to the desert to eat the spores. So spherules, very simple. So it is, remember, like this picture, a cock is eating the spores. Finished. Very simple. Okay, fine. The same picture can also, if in the option, if suppose in the diagram, based on diagram, if they give you rhinosporidium, that is correct. Rhinosporidium seaberry also has same picture. Okay, but anyway, that is the, it doesn't grow in any fungus, and that's different story. So you can do. And here what I'm seeing here, oh, I'm seeing a beautiful cartwheel. I'm seeing a cartwheel appearance, or sometimes called Mickey Mouse. Mickey Mouse, right? Mickey Mouse. Sometimes it's just like this only. It will be like this, and only one, two places you will see like this. That's it. So you see multiple budding yeast cells are coming out of the cell. So Mickey Mouse or cartwheel comes means itself, you know very well, there is this big ship. There is a cartwheel. This is a cartwheel. This is a cartwheel or pilot wheel, any wheel. Pilot wheel, sailor wheel, totally it should be a wheel. I'm saying a wheel. And who is driving this wheel? A parasailer. He is not a main sailor. We call him a parasailer. And of course, to entertain him, what he takes with him? He takes a beautiful Mickey Mouse. So Mickey Mouse, cartwheel, parasailer. So what does a parasailer means? I'm going to think about paracoccidiosis. Finished. I don't even think. I only saw the picture and all my clues are there. All the crazy ideas I made and I marked it. And that's the way micro is going to work. If you're smart enough and you remember, excellent. But for students who never touched micro, who finds micros difficult, believe me, it is the most easiest subject. You have to apply your crazy brain there. It's super duper easy. You can score with good marks. Okay, micro really elevates your mark. You know that, right? Micropathoparma are the intermediate ones which can elevate you to good level of ranks. Okay, so you got it, no? So we are easy. We have done with this. So pictures are clear. Now you're thorough. Next one. Look at this one now. Now another again. This, when you talk about mycology and parasitology, it's all pictures, image, which is we are diagnosing based on this image only, right? That's what. So now look at this pictures now here. I'm seeing here, what I'm looking here for now, I'm seeing a beautiful like a coin. Okay, coin. What coin? Like a copper coin, like a copper coin, metal, no, copper metal or something. Okay, copper metal coin like up here I'm seeing. So that is called what? When I see copper coin like this, that is called copper penny appearance. We call it as copper penny. Some people call it as medlar bodies or Murray form cell. Different names, they're same only, but different names are there. Medlar Murray form. Some people even call it as sclerotic body. Sclerotic, because it's like a copper, no, sclerotic bodies. So these are the different names. We'll go to the option. Just wait. Okay. Now, next one. This is the first one. You guess it. Okay. I've already given a clue and I've told all the things I've told. Copper coin. So copper penny body, medlar body, Murray form or sclerotic body options. Here I'm seeing a beautiful, you see it's like this. So it is sort of acute and I'm seeing a lot of septase. So it is acute angle septate hyphae. There are septas. You can see inside there are a lot of septas and acute angle. Acute means, it's 45-degree angle like that. 45-degree. Okay. So acute septate angle. So you make your guess. We discussed. So it's a revision now. So you guys from the previous classes, etc. I know you are guessing it correctly. Now look at this here. Exactly opposite to this. Definitely one question from this picture. I guarantee you. Definitely you will have it. Okay. Now look at this picture. You look this picture here. Wide. It's a wide angle, and no septase. There are no septa. Wide angle and no septas. Wide angle, no septas. Okay, next one. Other one, wow, look at this. It just looks like a star for me. Doesn't it look like a star? Star, but I'm going to write it asteroid. Asteroid and star, they're same only, no? So asteroid body. You know who is watching the stars at night. Asteroid body. Now you guys are going to tell me. First clue. Now we're going to answer. First, we're going to write the organism and then we go to the other side. So copper penny, sclerotic bodies. This type of picture comes, copper means chrome. So chromoblastomycosis. Chromoblastomycosis. Copper, chroma. The name chrome, copper means same only, no? So the chromoblastomycosis, no need to use my brain, unnecessarily wasting my time. I saw this beautiful coin. So it's a chrome, it's a copper penny body or sclerotic body. Fine. Acute angle. A, yes. God has given you clue. Acute angle, septate hyphae. So it is Aspergillus finished, Aspergillus finished, Aspergillus acute angle, septate hyphae, finished, easy. This type of wide and no shapeless comes, that is wide shapeless comes mucormycosis or zygomycosis. Zygomycosis. Mucor, okay, muc all wide, nothing, zygo, nothing is the opposite, just opposite to the zygo, opposite to the aspergillus, okay? Excuse me. Star. Who is watching the star at night time? The guy who works where in the garden. Garden. Who works in the garden? Rose gardener. The rose gardener is the one who's watching. So this is Sporothrix. Sporothrix. So that is the rose gardener. The rose gardener, we told the clue, rose gardener at night time, he smokes the cigar bundle appearance, and he watches the star, asteroid body. You got that. And the rose garden, rose garden. Okay, you have row of ulcers. Okay, now we're going to fix into the disease now. You know, when it's a chromoblastomycosis comes, the classic sign is warts, warts, warts. So do we have a warts here? Yes, I have a warts here. The name is called varicose dermatitis. This is a basically warts. It's seen in the farmers. It's because of only the legs or in the hand, you'll see huge warts like this. The original warts is caused by human papillomavirus. But this one, chromoblastomycosis, the name itself is called varicose dermatitis, which is a warts. Okay, first clue. Second one, Aspergillus means lungs. Lungs. Do I see something lung? Yes, I'm seeing a pulmonary, allergic bronchopulmonary aspergilloma, ABPA. Okay, also it causes fungal buzz, aspergilloma, fungal balls in the lungs also. It's caused by this only. Another clue. Easy, easy peasy. And the dangerous. Mucor means it's a dangerous, you know. In COVID, it killed a lot of people, and that's what the disease, sometimes they misnomer, they call black fungi. Everything got gangrene in the eyes, and you saw the pictures in the news, right? So, do I'm seeing anything like that? Yes, I got orbital disease. So, I'm going to be so happy. I got, because you know, whenever mucormycosis means it's a face only. It eyes, nose, eyes, and then brain. Orbital cerebral mucormycosis. Patient will have very bad prognosis because everything goes gangrene there, right? Gangrene. So I got it. I got the disease. So I don't even, this is the thing you need. You don't have to do the entire disease. You have to put the clue, symptom, and this is the picture how you get. So when we make a smile and see, this is what we are seeing. Okay, right. Now, of course, you know sporothrix, what happened. The classic symptom for sporothrix also, a row of ulcers along the lymphatic, another repeated question. This picture, this diagram has at least 10 times repeated question in your past years. All, each and every part with the diagram and the clinical features a question for you. Okay. So you know that the ulcer will be along the lymphatic. The word lymphatic is very important. Along the arms, either in the hand or the leg, you see a row of ulcers along the lymphatics. That's it. Finished. Very simple and easy. So no mistake in parasitology and mycology. Okay. Okay. So if you want to mark exactly, A goes to 4, A4, B3, A4, B3. Yes. So option E and CA and D2. Okay. Fine. Excellent. We're doing good job. Now, a 45-year-old male. Now, next question. A 45-year-old male asthmatic patient regularly using inhaler. Okay, asthma patient inhaler. Remember, inhaler is using. And he's using a white curd-like pack. Curd. The curd word comes, my mind will go to candida, candida, candida. Curd, cheese, milky appearance, white. It is candida. But here it is sort of plague in the buccal mucosa and tongue, and it's scrape of leaving an erythematous base. Yeah, you try to remove, it causes a this thing. Okay, scrape of leaving an erythematous base, it's leaving. Okay, fine. So that's basically an oral thrush. It's a oral thrush. Okay, so now which one of the following is not characteristic of this disease? First of all, it forms pseudo hyphae and budding. Definitely yes, budding. When you talk about candida, means itself the disease is candida. Whenever you talk about the candida, the real picture of the candida means itself, this is the one, what you're seeing here in this picture. You see this budding is cell, oval budding is cell like this, and some places not given, you will see pseudohyphase. You see a lot of pseudohyphase like this. Okay, you will see it. That's it. Okay, so that's correct. Reynolds-Brody phenomenon positive, definitely. That is the germ tube test. This test, germ tube. This is the test, germ tube test. When you put into plasma and leave it for 4 hours and take it out and see, you'll see the tube like this. It's sort of pseudo hyphae only, but especially we call it a germ tube. We call, okay, germ tube. Okay, positive. It's a oral leukoplakia? Of course not. That is the correct answer. It is not oral leukoplakia. This is basically Oral leukopenia is caused by HPV virus. I already told you another important question. Human papilloma, it's a pre-cancerous condition. It's a pre-cancerous condition which is caused by your I'm sorry, Epstein-Barr virus, not HPV, Epstein-Barr virus, EBV. Okay, sorry, I made a mistake. Epstein-Barr virus, Epstein-Barr virus, EBV. Okay, don't forget. Epstein leukopenia is EBV. Oral thrush is Candida. Don't forget that. Okay, very important. For treatment, cotrimoxazole or fluconazole can be used. Yes, of course. These are the systemic. For cotrimoxazole, when you have systemic Candida infection, you can use fluconazole. Of course, for oral, it's very good. Okay, that's it. So simple. Candida, we finished. Okay, and you know that the most common species is Candida albicans. Albicans is the most common Candida species, most common species. But nowadays, the question is most resistant species. Which is the most resistant, difficult to treat? Another repeatedly coming in the news is Candida auris. The most resistant Candida is Candida auris. The most common species is Candida albicans. And you know this, germ tube is positive for Candida albicans only. Especially, of course, you can use Candida dubliensis also, but mainly for Candida albicans, it is positive. Okay, that's it. This is also another important point you should know. That's it. Okay, so Candida albicans we have done. So, next question. HIV positive HIV positive patient, CD4 less than 200. Okay, first clue CD4 200. Then fever, headache, neck stiffness, nausea, vomiting, increased sensitivity to light and confusion. So this looks more like meningitis. Yeah, meningitis and encephalitis, but meningitis more. Okay, CSF1 is India ink. That's what the clue is given, India ink staining, and I'm seeing something. I'm seeing all this beautiful negative stain. Okay, so first clue, CD4 200 means the thing which should strike in my mind are three diseases. What are they? One is cryptococcus. Cryptococcus. Second one is your pneumocystis. Third one is your toxoplasma. Toxoplasma. Okay, and if you talk about brain, either crypto or toxo, both can cause, right? So fever, head, neck tick is there. So this can be toxoplasma, so those more encephalitis, ring enhancing lesion, but these two are possible. Now what happened? That's what you do CSF analysis. And you're seeing the India ink, which is a negative stain. India ink and nigrosin are negative stain. Whenever you do a negative stain, what you're detecting? Capsule. So you know the only capsulated, whenever the only capsulated is cryptococcus. So the disease is cryptococcus. You got it. Cryptococcus is the correct answer. So bad. Do we have anything to do here? Yes, probably. So what you're going to do here is cryptococcus, excuse me, yeah, cryptococcus. So capsule means cryptococcus. So now this is acquired by pigeon dropping. Definitely correct. That's what people are saying nowadays to avoid false statement. So they're saying to avoid. So we have to say false statement, but this is a true statement. Unless the pigeon dropping, correct. Okay, Cryptococcus neoformans. Okay, it's a dimorphic fungi. Definitely not. That is the wrong answer. Okay, because dimorphic fungi we told already hit, blast, cock. Right? Hit, blast, cock, paracock, spot, and pen. So do you see crypto here? No, it's wrong. So it's wrong. Okay, that's important question. Latex, that question can come. Which are the following dimorphic except is an expected question only. So be careful. Okay, latex agglutination test detects the polysaccharide capital antigen is more specific. Definitely yes. Latex and also lateral flow assay. Lateral flow assay. Both are important, rapid, and best test for cryptococcus. Okay, very important. Amphotericin B and flu cytosine is used for treatment. Another repeated question. Yes, this is also correct. Treatment for cryptococcus, especially when systemic happens, you have to give amphotericin B, liposomal amphotericin B, and flu cytosine. Both combinations is important. Okay, so your dimorphic fungi said dimorphic is a wrong option. So now you're clear with your this thing. Okay, cryptococcus. So cryptococcus means it's a pigeon dropping immunocompromised patient, and always remember the primary infection is usually in the lungs. Okay, but only when the patient has HIV patient, only HIV patient or immunocompromised state only, it affects the brain and causes meningitis. Most common cause of meningitis in the HIV patient, meningitis. Okay, most common cause, not normal, most common cause of meningitis in HIV patient, cryptococcus. Okay, cryptococcus. So don't forget that. This is very important. Okay, yeah. So this you're not going to make any mistake, and the specific this is always latex or latex. Though we have culture media, bird seed agar and other Niger seed agar we use, but this is the best one. Okay, fine. So we are thorough with that. Every point is important. Again, repeating. Yes. Now another question. A farmer, another repeated question. Nowadays, frequently I'm seeing this question. A farmer presents with a painless swelling in the left foot, multiple sinus, Discharging pus plus black granules. Okay, okay. And then they have reveals a septate pigmented hyphae. Which of the following is likely? Okay, first of all, based on the above picture, you see there is a swelling. I'm going to write it here. Swelling is there, plus sinus is there, plus there is discharge with granules. Discharge with granules. Simply, it's a very simple topic. Swelling, sinus, discharge. The granules. This combination comes, this swelling, sinus, discharge in the leg. If this is a leg, you have a swelling, you have a sinus, and then you're seeing some discharges coming out like this. So it's there. This is mycetoma. Mycetoma. You simply call it as mycetoma. A mycetoma can be two types. Actinomycetoma, and other place it's going to be eumycetoma. 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 That's all. First classification. Very simple. I'll tell you what to remember. Actinomycetoma, after A comes B. So bacteria. It is caused by bacteria. After E comes HEF, that is HEF, it's fungi. The common fungi, that is your Madurella species. Madurella, Madurai. It started in the Madurai, so called Madurella species. Common, though there are other things, but this is the most common one. When you talk about bacteria, it is Actinomyces or Nocardia. Actinomyces or Nocardia. Both are bacterias. Bacterias, Madurella. Okay. Is there any difference in symptom? Yes, the granules and the sinus. Here, sinus usually multiple. Not necessary, usually. Here, sinus can be few or multiple. Example, in this question, you see it's given multiple, so it doesn't matter. So that's fine. What about the granules? Granules in the bacteria, whenever you get a pus, a bacterial staphylococcus infection or any normal infection, the granules is going to be yellow in color. Yellow in color. But the moment you hear the word fungus, it was always black in color. That is the main point. This is the main point to notice. So when you talk about this yellow granules, it is mostly bacteria, Actinomyces nocardia. When you say black, it is Madurella species. Now, what should I do for the diagnosis part? For diagnostic part, first of all, because this is a bacteria, if you do a gram stain, you are going to see a filamentous bacteria, gram-positive filamentous bacteria. Gram-positive filamentous bacteria, which can be Actinomyces or Nocardia. Okay, Actinomyces or Nocardia. It can be Actino or Nocardia. So how to differentiate these two? Only one test. Acid fast. You do acid fast test, it will be positive, it will appear red color nocardia. Actinomyces is not. That's the main test. And of course, there's one take of paraffin bait was recently asked question. Paraffin bait. Paraffin bait, Nora Fathy. I told Nora Fathy 2 points you should know. Nora is a pure girl. She needs oxygen. Second one, she's fast girl, fast dancer, acid fast. Second one, everybody put a bait on Nora Fathy. Nora Fathy is a popular dancer. Everyone knows Fathy. You can remember like that. For you remember. If you do it also, no, it doesn't matter. So these are the two tests to distinguish these two. If it is, you're thinking no cardia. Whereas for your fungus, diagnosis is not that difficult. It's very easy. All you have to look for hyphae, fungal hyphae. Like this. All the fungal hyphae. Okay. So what is in the picture here? Here they've given beautiful pigmented hyphae is given. Septate pigmented hyphae. This is the picture. The word hyphae pigmented comes means it is fungus. Another clue, black sign granules. Though this multiple sign discharging sinus may be a little bit confusion, doesn't matter. For us important, a black granule and septate hyphae means it is fungus mycetoma. That is eumycetoma. Eumycetoma. So eumycetoma which is caused by Madurella. So what do you have in the options here? Do I see? Yes, directly they've given you mycetoma. That's it. So in option, they might give you Madurella also. Madurella, Fonsecae, anything they can give with fungus related, then it's correct. Definitely not Sporothrix, definitely not Botero. Boteromycosis is basically caused by Staphylococcus, Staph aureus. It's a bacteria, more fungal like. Actinomycetoma, we told it's a bacteria one. So out. So Madurella fungus is the correct one. Definitely expect. Nowadays, I'm consecutively 3 times in 3 consecutive exams, mycetoma questions appeared, which is a super duper easy question. No mistakes. Okay. So, sinus swelling, sinus discharge with granules, a classic mycetoma, either actino or U. A for apple. After A comes B, B for ball, bacteria. E for egg, E for elephant. After E comes F for fish, F for Fungus. Alphabetical order, finished. Your story is over. You know this very well. And Nora Fathy is a fast dancer. Everybody put bait on Nora Fathy was the last INCT question. So no mistake in these questions. Okay. Super duper easy. Nobody is allowed to make mistake here. Okay. Fine. So now comes the virology. We'll start 1 second. Just a second. Give me a second, please. So now we're coming to virology topic. Okay, so we finished microbiology, parasitology, now virology. Okay, so now first of all, the virus types with the respective diseases. You should, before going to this topic, a little bit you should know that viruses, when you talk about the viruses, there are only two types of viruses, DNA and RNA virus. DNA and the RNA viruses, most of the DNA viruses are double standard. We call double standard DNA virus. And when we talk about RNA, they are single standard RNA virus. Usually, this is the pattern. There are exceptions. There is some single standard DNA virus and there is a double standard DNA virus. So when you talk about single standard, who is a single? Our single paru. Single paru parvovirus. Single paru, Devdas movie, Aishwarya Rai, single, or any paru is single. Okay, small, and this is small paru, choti paru. In Hindi, there's choti paru, small paru. In when we talk about double strand RNA, it is basically rotavirus. Rota is basically Rio. Under Rio it comes, so rotavirus is the exception. So these are two exceptions. First, you should know. And when we talk about DNA virus, the virus group is happy virus. HHA-PPPY. I'm not going to write everything. H for herpes, H for hepatitis B virus, A for adeno, P for papilloma, pox, and parvo. These are the happy virus. I'm not going to go into details. Okay. Now let's come to a point. So, single standard RNA virus. So, most of them are single standard RNA virus only. So, let's wait. It can be anything, we don't know. There is only one double standard RNA virus we just spoke now. That is your rotavirus. Rotavirus. Okay. And single standard DNA, there's only one single girl in DNA. That is our parvovirus, right? And what about the double standard? All other people in happy, it could be any of the happy virus, okay? Any of the happy virus, which just I wrote here. So now we are going to one by one. Let's ssRNA will come later. It could be anything. So now let's talk about double standard RNA. When we talk about double standard RNA, rotavirus, very classic, most common cause of diarrhea in children. Oh, this repeated question, you know that, right? Rotavirus, never forget it. Most common cause of diarrhea in children is rotavirus only. So that question, you are not supposed to make mistake at all, right? That is very important. Yeah. So don't forget. So got it. Parvovirus. What about parvovirus? What disease you know about parvovirus? It is causing erythema infectiosum. Very good. Erythema infectiosum, which is also called slapped cheek appearance. Slapped cheek appearance, 1 point. Other one also called fifth day disease, because 5 fingers, no, they say five, slap cheek, no, 5 fingers. So they also call fifth day disease. Don't forget these. Every terms are important here. Erythema infectiosum, slap cheek appearance, or fifth day disease. Okay, all are important. So you're going to remember it. Apart from that, of course, you know that it is causing us to aplastic crisis. Aplastic crisis in children. Aplastic crisis, and also it causes it causes hemolytic hydrops fetalis, but non-immune hydrops fetalis. Okay, those are extra points. Okay, so at least you know this very good. Now, what about other two? Single standard DNA virus. So, what about this condyloma acuminata? Condyloma acuminata is usually caused by which one? Condyloma acuminata is caused by which one you know very well? HPV, human papilloma virus. So, what about a human papilloma virus? It is a papilloma virus, P. So it's a DNA virus. So normal double standard DNA virus. Correct. Okay. Koplik spot. Koplik spot is caused by which virus you know very well? Measles. Measles is a normal RNA virus. It's a normal RNA virus. So it's a normal single standard RNA virus. Koplik spot. That's all. See, multiple things are discussed. Everything was a previous year question. We put it in this way so that you not forget the classification of the viruses. DNA virus, RNA virus, mostly they are double standard. Here mostly single standard. Exception is parvo and rota. Very simple. That small chart will make a lot of difference. So don't forget this. Okay. So choti paru, single paru, and rota, double standard. No rota. Okay. Fine. Okay. So your answer should be A goes to 4, B 2. Yes, you got it. Okay. Fine. Okay. Virology. First question. Second question now. Second question, you can see a 30-year-old sexually active woman, okay, we present a painful vesicle in the external genitalia and bilateral lymphadenopathy. Oh my God, painful vesicle. That is a painful ulcer, genital ulcer, okay. Then Sangsmere showed this following image, okay. So now a very important question, repeated question. So this is basically genital ulcer. Whenever you say painful vesicle, it's type of ulcer only, okay, genital ulcer. And what happened, genital ulcer? The clue is painful. It is painful. Both the lymph node and both are painful. The word painful or it can be painless. So when the word painless comes means it's a painful comes means it's if you know that it is usually herpes simplex virus 2 or your Haemophilus ducrei. Haemophilus ducrei. Pain, 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 pain. Duck will cry. Okay. The name is of here cry, cry, cry. Cry means paining. Okay. And herpes simplex virus 2 is must know. It's only the main most common painful cause of ulcer in genital region is STD. We are talking about STD here. Okay. Sexually transmitted disease. Okay. Painless, the first most common would be painless. Syphilis, syphilis. I'm going to write syphilis, okay? It is syphilis, but I'm going to write syphilis. Syphilis. So basically syphilis. Apart from syphilis, of course, you're going to add your granuloma inguinale. Granuloma inguinale, second one. And of course, you can add your lymphogranuloma venerum, but their only problem is the lymph node would be painful, but ulcer is not painful. Okay, fine. Okay. So, we have done. Okay. So, this is another important thing. Okay. So, these two are painful and the other things all are non-painful. That's one clue for you. Now, so what I'm here clue, first thing painful given, so it should be either these two. But unfortunately, I've given Sangsmere where MNGC, multinucleated giant cells I'm seeing here. MNGC is a multinucleated giant cells. Multinucleated giant cells. This is very characteristic for either herpes simplex virus 1 and 2 or herpes zoster virus. Okay. So I got this is most likely to be herpes simplex virus 2. So when it's herpes virus simplex 2, you know the treatment of choice is acyclovir. That's it. All I got. So the answer here is it's a HSV2. HSV2, the drug of choice is acyclovir. Finished. Very simple. Why you make mistake? Okay. So say painful, pain, pain, no pain, painless. So syphilis. Here cry, duck cry, cry, and of course, obviously herpes simplex means of painful only. So that's too painful. Okay. So we're done with our thing. Okay. Next one. Another disease now. Match the following again. So what is the disease given here? So they have given that what is related common thing. Shingles, temporal lobe encephalitis, infectious mononucleosis, chorioretinitis. Okay. Now, first shingles. You know shingles means it is the chicken pox in the adults. Okay, adults chicken pox, but actually you don't say chicken pox. It's a reactivation of chicken pox in the adults. So that is caused by which one? You know very well. This is your herpes zoster virus, HZV. HZV, herpes zoster or varicella zoster, or we call it as a varicella zoster virus. Zoster virus. Okay. What about temporal lobe encephalitis? This is the most common complication of which virus? You know very well. Herpes simplex 1. Herpes simplex virus 1, not 2, 1. So that's just another repeated question. It's also called sporadic encephalitis. People also call it as sporadic encephalitis, they call. What about infectious mononucleosis? You know very well that is your Epstein-Barr virus, which is also called kissing disease. Kissing disease, our Paul Banal test. Okay, Paul Banal, that we repeated many times. Chorioretinitis, the term comes, the most common cause of chorioretinitis in HIV patient comes, Mrs. You know it is cytomegalovirus, CMV. Okay, so you got the clue. All are questions. Every point is a question here. You have to match with the right points here. Okay, how to match? Herpes zoster. Herpes zoster. What is the option? Painful lesion along the dermatome. That's enough. Painful, you know that. Unilateral, painful along the dermatome. On one side of the body, you can see patients having severe pain. Severe pain. Okay, that's the main thing. So, you know, the post-herpetic neuralgia will be there. So, correct option, shingles. Okay, zoster. Temporal lobe, we already spoke, HSV2. Infection mononucleosis, just we told. Paul Banner test or monospot. Monospot. Okay, both are heterophile antigen tests. So, that is another thing clear. Cytomegalovirus. Cytomegalovirus, we told that every chief minister's house, chief minister Stalin or any of your state chief minister house, they are having which bird? Owl. That's your favorite bird, owl bird. Okay, they're having owl bird. So, owl inclusion is another six, I don't know how many, 6, 7 times repeated question. So, okay, right? Owl inclusion bodies. So, 1, 2, so no confusion, right? So, shingles is chickenpox. Activation painful along the dermatome. Okay, post-herpetic neuralgia we call. Okay. So, yeah, A goes 4, B 1 and right. Okay, done. So easy, no? Super revision we did. Quick revision, Epstein-Barr, Paul-Banner or monospot. Okay. Which is the false statement regarding statement false? First of all, you have to see the picture. I'm seeing a warts in the vagina. So that is a genital warts. It's a genital warts. So the word genital warts comes means itself automatically my mind will think about HPV, human papilloma virus. Okay, now so HPV I got. It is caused by HPV 6 and 11. False statement. Definitely yes. Your HPV, this what genital what's one thing, and other thing what your HPV causes, especially 6 and 11. Okay, one it's caused by HPV 6 and 11. Okay, fine. Next question. E and 6-7 protein of this virus cause cancer? Absolutely. We discussed in the first part is in carcinoma only we discussed. Correct. Patient can have laryngeal papilloma? Absolutely yes. Either genital wart or laryngeal papilloma is a repeated question. Laryngeal papilloma, these things are caused by your HPV 6 and 11. These two things. Whereas your HPV 16, 18 and other things, they cause cervical carcinoma. Cervical carcinoma. This everyone should know. I know that most of you know. Even if you don't know, so no problem. First time who's studying Fmge students or Neet PG, remember it. Okay. So this one, HCV 16, 17. But your 6 and 11 causes either genital warts, which is called condyloma acuminata. This is basically condyloma acuminata. Another name is condyloma acuminata. Lata is acuminata. Lata is for syphilis. Acuminata is this one. Okay. Molluscum body positive? No, that's the wrong answer. Molluscum body usually seen the which virus? Pox virus. Pox. Molluscum contagiosum. You know that umbilicated lesion, with the umbilicated lesion with the cheesy material coming, that pox. There you see molluscum contagiosum. Okay, finished. So you got it right. So many questions we discussed in one question only. Right. Now, what about this? Presence of HBe antigen in HBV infection suggestive of. Okay, before going, let's just make a small point and then we go. Quick revision. So whenever you talk about hepatitis B virus diagnosis, there are only three things. You have to know six things. What are the six things? One is HBs antigen. Second one is antibody to this one. Antibody to HBs. HBs AG antibody. Second one, HBe antigen, EEE, and antibody to this one. Antibody to HBe antigen. Third one, we have HB, sorry, HB, okay, HBC antigen, and of course we have anti HBC antigens IgM and IgG. You know this. Thoroughly you should know this. Okay, repeated question will come from here. So when you see only HBC, it is yes or no. Yes, infection, yes. Infection positive. Okay, but when I already see an antibody, that means patient is recovery. Patient is already recovered from the infection or vaccinated. Okay, that's the meaning when you say antibody. Yes means yes or no. Yes or no. E means evil. I always say students remember, evil means anything with the replication, anything with the pathogenicity, anything with the infectivity, all these type of dangerous thing, replication, pathogenicity, infection, severity, those things are E. So if this is high, everything will be high. If antibodies rise means all these things will be low. Here it will be high. If antigen, everything is high, otherwise low. HBC antigen useless, nothing, no use at all. See, core, no, it's a core antigen, it's in the center part, useless. But it's antibody IgM. If M is raised, it says acute hepatitis B infection. If G is there, you know, like any other, G means chronic HBV infection. That's all. Sometimes this HP IgM also, it's very important in the window period. It's the main, the window period, which is the best indicator if they ask you any question. W and M look similar. So window period. That's all. This much only you should know in HBV. You must know. HBV lab diagnosis is a mandatory question. Okay. So now you guys answer. HBE antigen. E for evil. So anything related with the evil word you're seeing? Yes. Replication. I told. Replication. So that is the correct answer. Acute liver infection means I should check for IgM of the of your hepatitis B C core antigen. If it's a chronic, then I should check for IgG of the HBC antigen. Carrier phase is nothing. That is usually anti-HBC. Anti-HB should come. Okay, fine. So your answer is replication. So replication, pathogenicity, infectivity. Please don't forget E for evil. S for yes or no. M for acute. G for chronic. That much only. Yeah. So you don't have to think too much and waste time in these type of questions. Okay, fine. So next question. So the same thing we just speaking. Another diagnosis of the now your HIV patient. So here, look at this beautiful question. During the window period, sorry. So during the window period of patient with HIV, best diagnostic test. You know that. Okay. So still, we'll discuss HIV. Don't worry. First of all, AIDS. First of all, there is a normal screening test. Screening test, and there is supplementary test. Supplementary test for HIV. This we're talking for HIV, okay, AIDS. Then there's a test called confirmatory. Confirmatory. Screening test can be anything like you can say ELISA, you can say rapid test card test, okay, that is immunochromatographic test, ICT, like this two card will be there, or you have something called this comb. It's like a comb, like a real comb, only comb test, okay, or tridot. You'll have three dots called tridot. So these are screening. Okay. Any two positive, it's positive. Any two positive, then you confirm it as HIV positive. Okay. But if only one and the rest all are negative, then you have to send it for PCR. Ideally, according to our Indian NACO guidelines, any two positive, it's enough to say it's HIV positive. That's it. Okay. Supplement test. In supplement test, you do Western blot. Nowadays, we don't use much. So it's okay. Western blot. Usually, you detect the different type of proteins you detect. Okay. That's okay. Confirmatory, that's PCR. Okay, RT-PCR, of course, reverse transcriptase, RT-PCR. Okay, we are doing this the confirmatory. Also for prognosis, that is after treatment. After treatment, to see it's decreased or not, you have to use this. Not only that, PCR not only prognosis and confirmatory, but also one more thing, window period. Any bacteria, any infection during the window period, the best would be the PCR of that DNA. Okay, that's the best. Though we saw there in hepatitis B virus, it's okay. IgM we can detect window period, it will help. But also there also in window period, you can do HBV DNA, you can check. Okay, so same way here, you're going to do in window period. If you want to do, you have to do PCR only. So what is the option here? You have RT-PCR. Correct. Also not confirmatory, we have P24 antigen, but the best option is PCR only, because PCR will become positive in 12 days itself. At the day of 12 after the injection or sex or whatever, it becomes positive. Whereas P24, it takes 16 days to come positive. Okay, so best is of course RT-PCR. That's the question. Answer you should. PCR is the best one. Prognosis. Okay, this much only. Okay, so you know that prognosis always window period is RT-PCR. No mistakes. Now, electron microscopy. Electron microscopy is the only microscopy for viruses. You can't detect a virus in the normal microscopy. So picture is given, which is the best test for diagnosis of this organism. So first of all, directly they've given you question. Electron microscopy is, first of all, electron microscopy is the only microscopy for viruses. Only for viruses, smallest, right? So electron is the best one. No other microscopy you can use. Okay, that can also be question for viruses, which is the best. Electron microscopy is the best one. Okay, that you should know. Sorry. Okay, that you should know. Then other one is, hmm, okay. Now the other one you should know is the shape. So different shapes are there. This what I'm seeing here, it looks like a bullet for me. Bullet shaped virus. Bullet means it's a rabies. I always say some people are, when they have a dog, when it gets rabies, what they do, they take their gun and put the bullet, they will try to shoot it, right? Shoot the rabies dog. Simply like that. Imagine like that. Okay, they do like that, some people. So rabies bullet shaped virus. Okay. So virus isolation, which is the best test they ask for rabies, that. Though you can do this test, you can do this, all are correct. But the best is direct fluorescent antibody test. Here, what you're doing, you are detecting the rabies antigen itself. rabies antigen directly in the tissue. In the tissue, you will directly check it, right? You know, the sample of this tissue is taken from the nape of the hair follicle, nape of the neck hair follicle, nape of the neck hair follicle. So from there, you just take it and do a fluorescent, it gets positive. That's all. Okay. So in that case, some important viruses shapes might be a question. When you see this brick shape, sometimes they can give you brick and dumbbell. So it looks like a brick. It's a brick shaped actually with a dumbbell inside. This is brick with a dumbbell, dumbbell shaped DNA, dumbbell shaped DNA. So brick is looking like a box. So box means I'm going to think it as a pox virus. Okay, pox virus. Here I'm seeing a beautiful space vehicle. Repeated question this also. A space vehicle who owns Adnan Swami, the singer Adnan Swami. So adenovirus. Adenovirus, which is a space vehicle. Because Adnan Swami is having a space vehicle. Adnan Swami is having a space vehicle. Okay. Now you see a lot of, this is a cartwheel. This is a cartwheel. So you know that cartwheel means itself again, not only rota, that of course, not only your paraxylor who drives a car, but also your rotavirus. So many times repeated. Cartwheel appearance is in rotavirus. Here I'm seeing filamentous. When I say filamentous, after the closest alphabet to filamentous F is E. E for Ebola. Ebola filamentous also another question. So these are common expected diagrammatic questions for viruses. If they want to ask, they can ask you here. Okay. So no mistakes in this question. Fine. Okay. So these are different things. So we're done with this. And of course, don't forget one thing in the rabies, in the post-mortem diagnosis, you're using which one? You're checking for Negri bodies. In the post-mortem, I'm talking about the post-mortem. Antemortem, you're doing that direct fluorescent antibody detection test. Okay, you're detecting the antigen using the antibody. Here you're detecting rabies, you're going to detect the Negri bodies. For this detecting the Negri bodies, this is a special stain. You sell the rabies dog, cellular stain. Cellular stain, you sell the rabies dog, cellular stain. And you know in the brain, seen as the best part is hippocampus, or you use the cerebellum. Cerebellum. For postmortem, you use hippocampus or cerebellum of the patient or basal ganglion. Basal ganglion. Okay, these are the parts you're going to use for that, and you check for the Negri bodies. So, Negri body, bullet shaped, all this type of cellular stain, this question comes, you have to write about it. The answer is rabies. Okay, very good. Next question now. Now, look at this question. A mother brings a 3-year-old child after severe bouts of vomiting and diarrhea. Vomiting and diarrhea past 2 days. Then the diarrhea is watery, although mother denies seeing any blood. It's a watery diarrhea. So simply diarrhea is watery diarrhea. The doctor makes a diagnosis by an ELISA on the child's stool and assume that the mother that he will be fine with good rehydration. That's all. So all clues given: child, a normal watery diarrhea, vomiting and diarrhea, and the doctor says that says to mother he'll be fine with good rehydration. Whenever you talk about a childhood diarrhea, your answer should be rotavirus. Children, okay, children with diarrhea. Children with diarrhea. When they talk about children with diarrhea, it always goes to rota. So rotavirus. Answer is B. Very simple. Okay. So you got it. Very good. Next one. And do I miss here? Norwalk. Norwalk, remember, this is the most common cause of viral diarrhea in adults. Okay, Nora Fatih. We remember as Nora. Usually people go in the cruise ship. Nora Fatih goes in cruise ship and eating the seafood, so salads or whatever, and they get diarrhea. Then the answer should be Norwalk virus. Rota is for children. Shigella and Giardia will not. Shigella usually have a dysentery, so it will not come here. Dysentery, you know that. And Giardia, that is blood will be there. Blood will be there. So here, blood is watery, they said. Giardia, you should have what? Steatoria. Steatoria. They have what? Steatoria should be there. Foul smelling, fatty diarrhea. Steatoria. So that's out of the option. Okay. So you can rule out like this. Okay. So rota. Other things are possible, but most common is rotavirus only. Okay. Yes. Now the patient develops. Next one. A patient develops fever, arthralgia, retroorbital pain. That's enough. Retroorbital pain is the one only should click in your mind. That is your dengue fever. Dengue. So let's see what is there. Anything may be extra. So with the petechial rash also, laboratory showed thrombocytopenia and leukopenia. Obviously, it is dengue. It is going towards a dengue only. Which of the following statement is false? So you already got the clue. It is a dengue. It's a dengue that you know. Now what is statements? Which false statement? NS1 antigen detection is performed after 10 days of the illness. That is a wrong statement. Totally wrong. You know that whenever patients having dengue fever, when someone is diagnosed with a dengue fever, dengue hemorrhagic or dengue fever, the main test what you do, either less than 5 days or above 5 days. Less than 5 days, the best test should be NS1 antigen. Of course, it's ELISA only. NS1 antigen ELISA you're doing within 5 days. Um, till 5 days, up to 5 or less than 5 days. More than 5 days means you have to go for IgM ELISA of dengue, IgM ELISA. And of course, if it takes more than a month and all, you go for IgG, which is not that much important. But these two are very, very important repeated question. Okay, for dengue. Don't forget. Okay, and less than 5 days NS1 antigen, more than 5 days it is IgM ELISA. Okay, don't forget this question. Transmissions by Aedes aegypti, definitely yes. Yeah, you know that it's a tiger mosquito for dengue, all fevers. Okay, not only for this one, of course, your dengue fever, chikungunya fever, yellow fever, and one more is Zika. So all these things are spreaded by Aedes aegypti, tiger mosquito. Extrinsic incubation period of mosquito 8 to 10 days, fine. And then, of course, it belongs to flavivirus. You know the dengue means it's a flavivirus. Okay, fine, right? So now we are done with our important in dengue. And of course, don't forget in dengue fever, of course, called breakbone fever. People call it as a breakbone or saddleback fever. These are different names of saddleback fever they call for this. And main thing is platelet. When a platelet count goes less than 1 lakh, usually it goes less than 1 lakh in dengue fever. Okay, that's very important. Less than 1 lakh. Okay, yeah. Now we're done with this. Now next is another expected new viruses of the viruses nowadays becoming popular. That is one of them is your Zika virus. Okay, Zika virus. We talk about Zika virus. False statement. Zika flavi, yes, it's a flavivirus. Okay, I always say Zika noodles. Zika noodles are very popular noodles in Delhi. Noodles. So Zika is a flavor. It's very good flavor noodles. Okay, flavor flavivirus. Okay, right. Now, transmitted by Culex mosquito? Not. Why? Because just now we told all the, whenever you talk about the Aedes mosquito or tiger mosquito, Aedes or tiger mosquito, I'm repeating again, you all have to remember three fever. One is your dengue fever or dengue fever, chikungunya fever, yellow fever. So you should have four fevers. Other one is a Zika fever. So that's a wrong option. Yes, apart from the virus, sexual and vertical transmission is possible. This is Zika is that exceptional one, very beautiful one, which we like. That is not only mosquito bite, Zika is very special. It can go through sexual and also through the vertical transmission also. Okay, yes. Now, it can lead to congenital microcephaly or miscarriage if transmitted in utero. Definitely, yes. Zika congenital infection we call. Okay. Now, that one, when talk about congenital microcephaly, you see here's a special sign. This usually called subcortical calcification, or people call it as the zonal classification, zonal calcification. Okay, that is because it's between, you see here, it's between the cortex and subcortex, between cortex and subcortex, area between cortex subcortex. So we call it also zonal classification also, subcortical or zonal classification, all are same. Whatever you're seeing here, you see these things. That's it. Okay. So this is your Zika virus transmitted by this thing. You got the clue. Okay. So easy. So Zika virus we have done. Okay. And don't forget the Guillain-Barré syndrome. It causes Zika virus, one classically known for Guillain-Barré. Two important things causing, many viruses can cause. One is in the bacteria, Campylobacter jejuni. Okay. Other one is your, this one, Zika, which is commonly encountered with the Guillain-Barré syndrome, GBS syndrome, Guillain-Barré, you know, ascending paralysis, Guillain-Barré syndrome. Ascending paralysis, you know that, and I'm not going detail here. So these two don't forget. Zika and these two involved in Guillain-Barré syndrome. Okay. Now, another important, again, next, another important is influenza. Of course, I've chosen only the questions where examiners love to break your mind. Okay, break your head. Okay. Next one is influenza virus. So, in influenza virus A type, the influenza virus A usually produces mild self-limited febrile illness in general population. However, worldwide epidemics, pandemics have occurred at different time due to rapid changes in the viral genetic makeup. Which of the following is the most important reason why the sporadic Worldwide epidemics are happening. You already got the clue. Worldwide epidemics and pandemics occur due to rapid change in the viral genital makeup. Rapid change, that is genetic reassortment. Genetic reassortment. All I told was the word genetic reassortment, or whenever you say epidemic or pandemic, that is worldwide. So worldwide, one car which is popular, Indian car which is popular, is our Shift car. Yes, Maruti Shift. I'm talking about Suzuki, Maruti Suzuki only. This is everybody's favorite car. Every pandemic and epidemic means worldwide, the popular car is Shift car, which undergoes genetic reassortment every 10 to 20 years. Okay, that's what that car is popular. So we are comparing with the virus and the Shift car, Maruti Shift car. Okay, it's going to help you a lot. So the answer is shift, means for me it is shift. Antigenic shift is the reason. That is genetic reassortment. This virus, influenza virus undergoing genetic reassortment every 10 to 20 years is the reason for shift, which causes epidemic pandemic. Drift is basically point mutation. It is basically point mutation in some of the enzymes, hemagglutinin or neuraminidase, which usually leads to small epidemics, not big ones, small epidemics, not major ones, small epidemics. Okay, that's not very. Then it has happened every 1 to 2 years. It's happening. It's not a big problem. Just only some vaccine you have to change. That's it. But the major epidemic pandemic means shift. A class shift ka. A class shift A class. Okay, because influenza A virus class A shift ka undergoing major genetic reassortment. So it is popular, pandemically, epidemically popular. Remember, like worldwide. Okay. This is the way you're making some crazy stuff. Remember, this and all not. Hemoglobin develops if to destroy neuraminidase, no link at all. Shift is a repeated question. Shift car, influenza. Influenza, shift car. Genetic reassortment causes a major pandemic and epidemic. That's all. Very simple. Okay. And these things happening in the pigism, amplifier and all those things. Okay, these things, that's what swine flu. No, we're talking, when you talk about anti-shift, means all these reasons for avian flu, swine flu, all those things, avian flu, swine flu, this all are swine flu, all this type of new flu, whatever is coming, this one, because of this one. Okay, that's it. So we are now clear. This is a shift car. You are already, you're seeing the beautiful shift car. That's it. Okay, yeah. Now next question. A child presented with the cough, coryza, conjunctivitis, with a bright red spot in a blue-white center on the buccal mucosa. You see here all this buccal mucosa. 1 to 2 days followed by a maculopapular rash, which is the false. First of all, the disease very clearly tells which disease. If you're saying measles, you're correct. Okay, because you see this one. You see here this typical rash. What you're seeing, this blue-white center, bright red spot with blue-white center, is Koplik spot. Koplik spot. Okay, and then you see initially it started with CCC, three C's. It started with the three C's, then Koplik spot, and then maculopapular rash. So this all points to measles. What is false in the measles? We are going to find. And measles, important question. Giant cells can be seen in the lymph node biopsy. Definitely yes. Okay, definitely giant cells can be seen. You also call it as this giant cells Warthin Finkidley. Warthin Finkidley. Warthin Finkidley. This word Koplik spot and Warthin Finkidley is a repeated question. Example. Okay, commonly asked question. Yes. What about SSP, subacute sclerosing panencephaly? Definitely yes. And giant cell rare possible sequelae. That's what, for diagnosing this one, you have to do IgG of measles. IgG measles is a chronic brain condition. Okay, it causes panencephalitis. Patients have neurological problems. It's rare. It happens after so many years only. Okay, that one. Vitamin A supplementation recommended? Definitely. Only for measles you use this special vitamin A. I don't see anywhere else you're using. Especially for measles, it's mandatory. Okay. And for vaccine, Gerillin. Oh, oops, that's wrong. Gerillin is for mumps. Gerillin is for mumps. You know very well, for our measles, we are using Edmonston, M for measles, and Jagarib. Jagarib. We say Garib people or poor people, no? Garib, Jagarib. Okay. Edmonston, Jagarib means poor people. Poor people are what we have to give to poor people? Measles vaccines. Okay. M for measles, Edmonston. Jagrib is for poor people, so Jagrib. Okay, so this vaccine. Gerillin is for your moms. So don't make mistake. And for rubella, don't forget RA. For rubella vaccine is RA 27/3. So 3 for MMR vaccine. I'm just speaking because we're talking about MMR here. Okay, so all the three stains we know now. Okay, clear, no? So no mistake. So all points, every point is important question here, every point. Okay, next one. A child presented with the PDA, patent ductus arteriosus, and cataract, which is the likely infection. You got it. Okay, I don't even have to say. Basically, it is a rubella. This is rubella. Okay, rubella. Answer is rubella. And you know rubella. Why? Because in rubella, the shortcut is CCD. And I told always we'll take the rubella mother to CCD when a child gets take to CCD. Why CCD? Coffee, coffee day shop. Why CC? C for cataract. First C is for cataract. And second C is for cardiac problem. In cardiac only, we just told now patent ductus arteriosus, common cardiac disease. D for deafness. The child will have deafness. Okay, that's it. So you got already cardiac and this thing, cataract given. So PD. Of course, the child has a blueberry muffin. That's not a triad, but blueberry muffin also possible. Blueberry muffin rash. Muffin rash. Okay, very simple. That's it. So usually, so but in what about in cytomegalovirus congenital? If you have with cytomegalovirus, the child will have microcephaly, and the child can have microcephaly and calcification. You know that intraventricular calcification, intraventricular brain intraventricular calcification, also chorioretinitis. That is common for the CMV. Toxoplasma, we also almost similar to CMV, except there will be, we already spoke, intracerebral calcification. Okay, intracerebral calcification, not intraventricular. And there can be micro or macrocephaly is possible. Same like Toxoplasma CMV will be almost similar only. Only few, the calcification sites are different, and macrocephaly will be seen only in Toxoplasma. Sometimes, okay? Sometimes, okay. Herpes is not that important here. Okay, fine, okay? Right. Now, next one. So this picture is done. Now, next one is your viruses with a family. It's very important. Sometimes they'll ask you the family to match is very important. Can be one question also. Nifa, it belongs to paramyxovirus group. Okay. We told paramyxum, param, P-A-R-A-M-M. Param नहीं है. Param नहीं है means is not at home. नहीं है. Okay. So here only I'm not going to all the viruses here. P for parainfluenza. Okay, no problem. Parainfluenza. R for RSV virus. M for measles and mumps. Measles, mumps, and N for Nipah. Nipah, another popular, fruit bat. When you say Nipah means you should always remember fruit bat. The word fruit bat is given, it's a Nipah virus. Okay, that's important. Zika. Zika, just now we told, Zika noodles are flavor noodle. Zika is a flavor noodle. Zika, flavored noodle. Flavored noodle. This question was asked in one of the exams, so that's what I'm stressing here. Ebola, we told, Phil Bolo ko mara hai. Phil Bolo ko mara hai. Phil Bolo ko mara hai. Phil hit the bola, right? So Phil is Filoviridae, Bola Ebola, Marburg. So these two viruses belongs to Filoviridae. So Phil Bolo ko mara hai. Filoviridae. HIV is retrovirus. You know it very well. Okay, so that's all. So Nifa, A for 4, A for B1, A for B1. That's it. Okay, simple, right now. So this is also, you should have to go few viruses. You have to know it. Okay, right. So bacteriology is done. So now we are going to our bacteriology. I mean, virology is done. So 3 important times. Now we bacteriology. Bacteriology is definitely bigger one. Little bit of immunology. This is the main thing you needed. Okay, for exam. Okay. Attention, and very important because bacteriology is a huge topic. You know, to 20 questions. What are we getting in micro? Around 10 will be from bacteriology only. Right? Rest only they will distribute. 8 to 10 from bacteriology only. Okay. Let's start. So first of all, what I'm seeing matches the following. You will have one of the pictures surely. In this picture, gram stain. It's a gram stain. So first, what I'm seeing here, I'm seeing a gram positive cocci in cluster, grape-like cluster, grape-like cluster. So that is which one? That is my Staphylococcus aureus. When I see a picture like this, that is Staphylococcus, any Staphylococcus, but I'm going to write Staphylococcus aureus. Okay, Staph aureus, because staffs like grapes. Staffs like grapes. Okay, this is very going to be easy. So here, what I'm seeing in the next picture, I'm seeing a gram-positive cocci in chain. Chain. The word chain means itself, it is a Streptococcus. Streptococcus. Okay, now next one. I'm seeing again next picture, gram-positive cocci in pairs. Pairs, but I'm seeing it a lanceolate shape. Lanceolate shape. No, it's like this. Lanceolate, okay? Lanceolate shape. So that is Streptococcus pneumoniae. Streptococcus pneumoniae. Okay? Streptococcus pneumoniae. You know that one. Last one is here. This is a pink color. So it is a gram negative. So this is a, I'm going to write different colors better. So it is gram negative cocci. Gram negative cocci, but this diplococci. Diplococci. So this is Neisseria. And it is intracellular. You can see intracellular. This one, what I'm seeing here, intracellular, these things. So Neisseria gonorrhea. Neisseria gonorrhea. So what happened? What in the question they'll give you? They'll give you the clinical symptom and they'll just give the picture and tell you to identify. That's all. Okay. So that's what you should be careful. So now what happened when I'm seeing a gram positive cocaine staph aureus? What's the disease of staph aureus? Of course, carbuncle and abscess. Carbuncle, furuncle, boil, all this abscess skin things will come. Staphylococcus aureus will come. You know it. Streptococcus, let's go in reverse order also. Let's come from this side. Painful urethral discharge, definitely your gonococcus. Gonococcus, okay, painful discharge, most common cause of urethral STD, sexually transmitted disease, genital urethral discharges, gonococcus followed by chlamydia. You know it. Now, what about lobar pneumonia? Definitely it is your Streptococcus pneumonia. So life becomes more easy because the name is a Streptococcus pneumoniae. So it is the most common cause of lobar or community acquired pneumonia. You know it. Pharyngitis, cellulitis means strep throat. We call strep throat. Streptococcus pyogenes. So this one. It can be any streptococcus, but yeah, according to the option, you're going to. So it's basically streptococcus pyogenes. Okay, it can be any streptococcus, but I will streptococcus pyogenes. Okay, finished. So this is easy one. So it's the easy one. This and all, if you make mistake, then it'll be very tough. Okay, your rank will go down. Also, you shouldn't make mistake. Make sure you're not going to make mistake. Okay, so 1D, 2C, 1D, 2, 1D, 2C, 3B. Yes. 3B, then 4E. Okay, fine. Okay, easy question. Next one. Look at this question now. A female patient presented with the fever, vomiting, rash, desquamation, and the end organ failure associated with the vaginal tampons. That's it. Okay. So this looks like a toxic. It's something looking very toxic. See, this is end organ failure, shock, everything is there. And it's a female also. And tampon history was given. So there's definitely what we're talking here. We're talking about toxic shock syndrome. Toxic shock syndrome. Toxic shock syndrome. That is TSS, toxic shock syndrome. So toxic shock syndrome itself, we are talking about the FFF. Female first. Okay. And then female. Toxin name is enterotoxin F. Enterotoxin F. And it is fatal because very, very poisonous. So this enterotoxin F is also called as TSST1. We already told T. It's also caused by TSST1. The main reason is tampon contamination. Sometimes tampon, sometimes nasal package, nasal pack. Some if you leave this tampon contaminated, basically they're contaminated. They left for long time use. No, so it can happen. So when you talk about this one, this is caused. Okay, this is caused by which one? This is released by which? It's by Staphylococcus toxin. These are all Staphylococcus toxins. Staphylococcus aureus toxins. Okay. So whenever you talk about Staphylococcus aureus, so when you talk about Staph aureus, you know very well, aureus means both catalase positive, also coagulase positive. Both are positive. Catalase and coagulase positive. Okay, if coagulase negative, you call it as cons. That is Staph epidermidis and saprophyticus. When both cat and coagulase positive, it is Staph aureus. You know that very well. So now I have to put it here. So whenever there's a coagulase negative, I'm going to cut that option. Cut it. It's not because that can't be. This is Staphylococcus aureus only. So okay, so I have two options: positive, positive. What about the toxin? TSST1, yes, that's what I'm saying. So it's a TSST1, or we call it as also enterotoxin Hef. This is correct option. What about enterotoxin A here? No, enterotoxin A is involved with the food poisoning. Food poisoning, most common cause of food poisoning in this by Staphylococcus aureus. Okay, so it's clear. So toxic shock syndrome, female, fatal. So everything is FFF, female, fatal, enterotoxin F. It's also called toxic shock syndrome, female toxic, something like that. You remember? Okay, that's it. So we're done with this. So very easy. Now next one. 15-year-old, 15-year-old. Yeah, a 15-year-old innocent girl. So she present with a skin lesion while recovering from the varicella infection. Okay. The medical history, the patient is diabetic, first clue, and you see numerous crusted vesicular lesion left on with erythematous area with violet dark center. Okay, dark center. That's important. So this is the one they are saying. Already it looks like necrotized. Okay, necrotized. And it is extremely tender, mild pressure. The girls cry out in pain. So the girl is crying very much. Okay, diabetic with this typical lesion, necrotic material is already seen. Okay, and then sent for culture, and the organism shown on gram stain is this one. So typical. What it is? Streptococcus. First of all, the gram stain, what it was shown, Streptococcus. This is Streptococcus. Okay, but what is the clue for you? Here what you're seeing is, it is basically, it is a cellulite. Initially, it might have been a cellulitis. Cellulitis might be. Now it is becoming a necrotizing fasciitis. Necrotizing cellulitis or necrotizing fasciitis with the diabetic history, diabetes mellitus history. Diabetes mellitus history, cellulitis or necrotic material, this is very important to say, that is necrotizing fasciitis, automatically the streptococcus. But which streptococcus it will be? Streptococcus pyogenes. You know that streptococcus pyogenes cause two things. Either it causes a throat infection, strep throat, which was in previous, it causes the pharyngitis, or other one is it causes a skin infection. In skin, all these things, cellulitis or necrotizing fasciitis. Necrotizing FACI, fasciitis. Okay. Yeah, sometimes erysipelas also, cellulitis, it's erysipelas. Okay, erysipelas. Okay, this is localized form of cellulitis. Okay, so these are the common cause for streptococcus pyogenes, which is also called group A streptococcus. So this is, don't confuse. Sometimes if they give you group A streptococcus also, it's correct. Streptococcus pyogenes or 18. Okay, cut. Okay, so now, and also one more thing, if you want to remember, I told whenever group pyogenes comes, streptococcus pyogenes pi, so everything should be pi, basi, y, like this, pi, basi, y, like this. Because y for pi, because you know a lot of things are there. PYR test positive. Okay, pi. Bacitracin sensitivity positive. Bacitracin sensitivity positive. Y, wide zone of hemolysis. Wide zone of hemolysis. Also, VI is there. VI is basically the agar media is called violet blood agar. Violet, crystal violet blood agar you call. Okay, violet blood agar. Okay, fine. So now the direct question is, the following organism most likely causative agent is your Streptococcus pyogenes, group A. Or simply they give you group A Streptococcus, so that's also correct. Okay, I've given revised everything now. So this is important. Don't forget, the Streptococcus pyogenes only what happened? They can cause rheumatic fever, or post-streptococcal glomerulonephritis. These are two autoimmune disease caused by your streptococcus pyogenes. Don't forget, okay? Just so we will finish all the streptococcus pyogenes here, okay? So important one, right? Now, Max, the next one, another question. Now, this is beautiful here. You see here what you have given. You got here a beautiful, I'm looking here a bamboo stick. Bamboo stick. It looks like a bamboo stick, no? You see bamboo stick. This one looks like a box car. This one looks like a Chinese letter. Chinese letter. You see the appearance, no? It's looking like this, and all. This is looking like a typical box car. Box car. Here I'm seeing a filamentous. Gram positive filamentous. This is all a violet color. So anything violet, it is gram positive. Positive, right? Yeah. You know very well, bamboo stick. Who is that? Who is that holding a bamboo stick in a picture? A Christmas tree, bamboo stick, Medusa head, pearl. Who is that? Our Andrea. Some people, I told, remember Andrea. Some people remember it's goddess. Anthrax is a goddess, no, dangerous bioterrorism god. Anthrax, okay, goddess Anthrax. So, Bacillus anthracis. Bacillus anthracis. Okay, Bacillus anthracis. Box car. Who owns the car? In Telugu actor which has variety of car collection is our Mr. Perfect Nagarjun. Nagarjun is Mr. Perfect. So Nagarjun, Mr. Perfect, we are going to make a close to him perfringens. Perfringens. Nagarjun because of one reaction, Naegler's reaction. Naegler's Nagarjun reaction. Naegler's reaction is a Clostridium perfringens in gas gangrene, you know. Chinese letter means it's of, you know, Corynebacterium diphtheriae. Corynebacterium diphtheriae. So Chinese children have diphtheria. Corynebacterium diphtheriae. Gram-positive filamentous, we just spoke before in the mycetoma. When you talk about gram-positive filamentous, it is actinomyces or it is nocardia. Or nocardia. Okay, fine. Now, let's fill the answer. Bacillus anthracis, what disease it causes? Directly wool sorter disease. Okay, the most common case, either it causes Hailey Potter. Hailey Potter is the most common disease. Hailey Potter disease is usually the animal handler. We know, I'm not going into detail. Hailey Potter, which is cutaneous anthrax, which is the most common type. But the most dangerous type is usually wool sorter disease because of it's affecting the lungs. Wool sorter means it affecting the lungs. Okay, simple. Got it? Next one, boxcar means, so it is our Nagarjun. Nagarjun means it's of, it's a gas gangrene. So what's the gas gangrene given here? Typical gas gangrene. Excruciating pain with crepitious means it's a gas gangrene. So gas gangrene is caused by Clostridium perfringens boxcar appearance, and of course don't forget reverse camp test positive. So Nagarjun is a little bit crazy fellow. Everything he does ulta, reverse camp he does. And of course, the name Nagarjuna, because of this Naegler's reaction, it is one of the antitoxin reaction, just the name for now. And also, don't forget, he drinks litmus milk. Litmus milk fermentation positive. Litmus milk fermentation positive. Okay, these are few points. And of course, hemolysis. He is always having a very good target in the movie. So target hemolysis. Okay, double zone or target hemolysis we call double zone or target. Double zone or target hemolysis. Okay, double zone. Okay, or double. He has two Fs. Nagarjuna has two Fs. You know that. Okay, so first one, second one. So that got so double. Okay, is double. Whatever you want to remember. Okay, Chinese letter. Connervatum diphtheria. You know, connervative diphtheria means it's a pseudomembrane. Removing the membrane causes bleeding. So that is pseudomembrane. So that is basically pseudo membrane. So your connervative diphtheria goes this one. So this all they can give you clinical feature and give the picture or whatever, but please expect. Again, this box has a high weightage of one question, sure. And this one, actinomycinocardia, just this. We just spoke before mycetoma. Here it is actinomycetoma because it is bacteria, so it is actinomycetoma. Swelling, sinus, discharge. Swelling, sinus, discharge with granule. Okay, that's it. Very easy. So no mistakes in this question. A to B4, A to B4, right? Okay, that's it. Easy. So don't worry, it's easy, micros easy. Please go through this nicely. If you have not any other plan, if you haven't made any other revision plan, you're going to first time, just you're trying, go through this, okay? Go 2-3 revision. I don't, exam is nearing. For Fmge, I know it's difficult, but whatever, okay, possible, do it, okay? And for, of course, Neet, PG, Inicet, you have plenty of time, so please go through it, okay? I'll send the PDF also later, and I'll attach with the video, so you can check that, okay? Now, next one, match the following. So diphtheria toxin, you know that I'm going to start very deeply. So there are two types of toxins acting mechanism. One is decreased protein synthesis. Some bacteria act through decreased protein synthesis. Very well, you know, that is DPS. The name is DPS. DPS. And some bacteria acts through cyclic AMP mechanism. Okay, cyclic AMP, and some through cyclic GMP mechanism. These are the basic mechanisms. Okay. So when you talk about these two, D for diphtheria and P for Pseudomonas. So these two bacteria, they are common mechanism inhibiting the EF2 factor, elongation factor, and decrease of protein synthesis. Yes, for Sheila anti, Shiga toxin. Okay, Shiga toxin. So this one Sheila anti 60 years old. I told 60 years. She is 60-year-old. Okay, 60-year-old. That means it inhibits the 60S unit. And then finally, what happened? They decrease the protein synthesis. Cyclic AMP, you already have a clue. Cyclic AMP mechanism action, CAMP. C for your cholera, A for anthrax. This cholera was asked, anthrax not asked yet. E, if you turn, E. coli, but labile toxin, labile. Anxious people are labile, we call, no? Anxious labile. And P for pertussis, also recently asked question. Okay, pertussis was also asked. Okay. Cyclic GMP, good people. Good people are stable people. Good people are stable people. So when you say good people, stable people, I'm talking about E. coli's stable toxin. Okay, E. coli, stable toxin. That's all. Okay, this basic thing, and there are different mechanisms that you individually also we will see. So here now you go. And one more thing, and don't forget for your Bacillus and Bacillus cereus. Bacillus cereus is some important thing here. Okay, for Bacillus cereus, what happened? B cereus. B cereus when you use Chinese fried rice. So the two types, either vomit type or it is diarrhea type. Vomit type or diarrhea type. You know, vomit goes to throat. In throat in Hindi, it's called gala. Gala, right? Gala say vomit. Diarrhea goes through anal. Through anal region only diarrhea will go. So what do you mean to say here? So gala G. So this is cyclic GMP mechanism. G for G gala. That is which one? Vomiting type, emetic type. The emetic type mechanism is through gala, Anal is diarrhea. Diarrhea is anal, A for A. So it goes to cyclic AMP. Cyclic AMP. Okay, that's the clue. All this much only. One question expect. Toxin mechanism is important. So these all are basically, we're talking about the exotoxins. Okay, exotoxin, which is also sort of enterotoxin. Part of enterotoxins are part of exotoxin. Okay, exotoxins. Okay, so diphtheria toxin we just spoke here, inhibit the EF2 factor. Just I told EF2 factor, inhibit protein synthesis. So your answer is this one. Stable people are good people. Stable people are good people. So cyclic GMP. Diarrhea, basically serious diarrhea. Diarrhea always goes through anal region. Anal. So cyclic AMP. Cyclic AMP. Tetanospasmin, you know. Tetanus means it's of inhibiting the inhibitory mediators. Inhibiting the GABA or glycine. Both are correct. GABA and glycine. So they are inhibitory mediators. Inhibitory mediators. So that's also correct. Okay, inhibitory mediators. So your answer should be A for 4, A for B3, A for B3, C2, D1. Right. Okay, correct. Okay, very simple. No, so no mistake. Toxin one question, sure. Endotoxin is always, endotoxin is totally different. Endotoxin is non-specific. Exotoxins are specific mechanisms. Okay. Now, next question. Another question, interesting here. A 45-year-old diabetic patient, okay, presents with an ulcer on the sole of the left foot. Okay, ulcer, fine. Left foot displays edema, thin, malodorous discharge, ulcer, crepitus. That's it, crepitus. The word comes here. The clue word for me here is diabetes. And having crepitus has come. Initially, it was thin abdomen. So that means there is already gangrene. Probably gas gangrene. Crepitus is there, so it's a gas gangrene. That means necrotizing. Necrotizing fasciitis. Now I'm going to stop here. The word necrotizing fasciitis, two bacteria which should strike my brain. Streptococcus pyogenes, which we spoke, cellulitis, necrotic, previous one. Another one is our Nagarjun. Nagarjun, what happened? Poor guy in the movie theater, after burns and everything, he fell down, Mr. Perfect Nagarjun, and he got what? Clostridium perfringens. So Clostridium perfringens. Two things, okay, possible for getting necrotizing facet, anything gangrene. So let's go deeper. A deep swab from the wound was collected and sent for gram stain, aerobic and anaerobic culture. The gram stain was done. And the figure was shown. It best describes the toxin that is produced during this section. Okay. First of all, look at the clue. The fight is between Streptococcus pyogenes or Streptococcus perfringens. If it was a Streptococcus pyogenes, it should be cocci in chain. G gram positive cocci in chain. If it's a Clostridium perfringens, we just spoke, it should be bacilli, boxcar appearance. It should be GP gram positive bacilli. So, what is the picture given here? A beautiful gram positive bacilli. Also, boxcar. Sometimes you call boxcar. The spores is not visible here. Usually you don't see in gangrene. Boxcar. So definitely this is Clostridium Mr. Perfect. When Clostridium perfringens comes itself again and again remaining, you have to think Mr. Perfect. When there is a Mr. Perfect, only Mr. Perfect in our Telugu movie is our Naga. Mr. Perfect, Naga to Negler's reaction. Whenever you talk about Naga, automatically you think about Naga. See, this is our Naga. He is a what male? Alpha male. He is very toxic alpha male. Not toxic alpha male. Okay. Alpha toxin. So that alpha toxin is the main toxin. Sometimes we call it as the lecithinase enzyme. So this is the one. You see, he has a target. I show target lesion. Oh, that picture is not. That's fine. Okay. Target lesion. This is the typical gas gangrene you're seeing. Gas gangrene. See, a lot of cars is having box cars. Okay. So few clues we've given. And okay. So what is the toxin here? Already it's written. Alpha toxin. Or if they've given it as lecithinase, it's correct. Correct. Okay, that much only. Edema factor is more for anthrax. Anthrax. Exotoxin A is more for Pseudomonas and diphtheria. Pseudomonas and diphtheria. The LPS is for lipopolysaccharide means of any negative people, gram negative. All gram negative bacteria, they have LPS. Negative people have fat LPS, we told, right? So negative people, finished. Easy peasy, no mistake. Nagarjun, Mr. Perfect, gram positive bacilli. He has a box car and he has alpha male alpha toxin. He has a target hemolysis, always his target. Reverse camp, okay? Reverse camp test. This much only you have to know, okay, right? Next one. Look at this question. Now, and a 29-year-old female hospitalized with a community-acquired pneumonia. So it's a pneumonia. 7 days she was treated with cotrimoxazole, azithromycin. Okay, fine. However, on fifth day of hospitalization, she had severe watery diarrhea. Okay, so it's because of antibiotics. So she took ceftriaxone, azithro, and she's getting severe watery diarrhea. And she's going many times, 20 times per day. It's accompanied with bilateral lower quadrant pain also. The stool is done, the test that establishes the diagnosis. Okay, a stool test was done to establish the diagnosis. Which of the following would be most likely test to establish the cause of women's diarrhea? Okay, another very important question. Expect this question also. So already we know this is antibiotic. After antibiotic only she got diarrhea. So I can go into put it as an antibiotic associated diarrhea. Antibiotic associated diarrhea. When I'm writing antibiotic deficiency, this is also called as pseudomembranous colitis. Pseudomembrane, some people call it as pseudomembrane colitis, antibiotic associated diarrhea. And the classic thing which is causing this is Clostridium difficile. Life becomes difficult when you take antibiotic. Difficult. Okay, when you take antibiotic. The most common cause of this is which antibiotic? You know, it is a ciprofloxacin followed by Clinda. Then followed by anything. It can be amox, ampicillin, whatever drug you can write, every drug, most of the drugs. Okay, this is what you see. This is a pseudomembrane colitis. This picture also they can give you like the pseudomembrane. Okay, get it. What you have to do now? So you have to the diagnostic part. Diagnostic part, either you do culture or PCR. You take the stool, you do culture, or you can do PCR. Okay. Fine. And then treatment. Treatment, of course, you know, the best now drug of choices, FDIF. If you turn this side, it becomes Fido, F5D. So, fidoxomycin is the drug of choice. Treatment is antibiotic only. It's caused by antibiotic. Also, treatment is antibiotic. That's the beauty of the pseudomembranous colitis. And of course, you're going to give oral metro vancomycin. Okay, other drug of choices. Mainly fidoxomycin. What's the option here? They ask most likely test to establish the woman's diarrhea. So though you can do definitely not urease breath test, that is for H. pylori. That is for H. pylori, stomach related. PCR for toxins and gram stain culture. So the most likely the best is always PCR here to detect the toxins. Because this Clostridium difficile toxin is the main reason here. So detect that toxin, exotoxin, you are using PCR. Okay, that's much better. Then culture or gram stain. Culture gram stain you can miss also, so that you will not. Okay, fecal lactoferrin not that specific. So PCR with for toxin is the best option. Okay, right. Next one. All of the following are diagnostic method for microbiome TB, except, okay. So when you talk about TB, when the TB disease comes message of Microbiome TB means it's a culture or PCR only main thing. So whenever it's like microbiome TB comes, you're classifying it this. First is microscopy. Microscopy, you're going to do acid fast or ZN stain. ZN stain. Second one is your culture. Third one is your molecular test. Molecular test. So whenever you talk about culture, it would be conventional culture, LJ media, or it is automated. In automated, you're going to use which one? Bactec or Bactalert, Bacti, Midget, Bactalert, all these things. When you talk about molecular, definitely you're going to never ever forget CBNAT. This is now revolutionizing, very, very important. The automated version also is used. Excuse me. Yeah, sorry. Okay, so you go to using CBNAT. Okay, molecular you can use the CBNAT, or you can use what else? Line probe assay. CBNAT and line probe assay. So CBNAT is otherwise CBNAT is also called as the gene expert. Gene expert. CBNAT or line probe assay. That's all. This much only. Okay. So these are things you should know. Molecular, which is CBNAT, LPA. Line probe assay. One thing you have to know here. In CBNAT, only rifampicin resistance you detect. You detect only rifampicin resistance. Rifampicin resistance. Rifampicin. Okay. LPA, all the drug resistance can be detected. All the anti-TB drug, all the anti-TB drugs can be drug resistance can be detected. That's another important point to notice. Okay, especially first and second line easily you can detect. That's all. Okay, so these are three things. So do we go here? Bactibacter, definitely yes. Bactibacter is for culture. Gene expert or CBNet, definitely yes, correct. Line probe say LPA, yes, this is LPA. Okay, LPA line probe say yes, correct. Nine band armadillo, not at all. Nine band armadillo is for your leprosy. It is for your leprosy. It is for your leprosy. Mycobacterium leprae. So leprosy. Okay. That's it. This much only in your thing, in Mycobacterium TB. Okay. So no any mistakes. Okay. So you're going to do very well. I know that. Not make any mistake. Okay, fine. Now next one. A 56-year-old man presented with a slow growing, painless, soft tissue. Excuse me. Okay. Now, a 56-year-old man present with a slow growing, painless soft tissue swelling in the perimandibular region here, okay, 2 months. There was a discharging small amount of pus, small opening, skin, okay. Then skin 2 weeks earlier and a small sinus discharge, thick white exudate. Already you got, see, sinus is there, swelling is there, white exudate. Biopsy was performed, a scanty gram-positive branching filament was seen, and then modified quinone was done, positive, acid fast is positive, and then presence of multiple granules, PMN cells, etc. What is the causative agent? Okay, every clue is given. This again and again I'm repeating my symptom 3 times I've written here. It's very important. Okay, so first of all, your diagnosis based on this is discharge mode of pus. This also shows that patient is having with also yellow exudate. So this is causing mycetoma in the face, which is caused by bacteria. Okay, because you have a yellow color granules. Okay, so it's a bacteria. So then what happened? They saw branching filament also. So it's a bacteria. So they saw filamentous like this. So it is actinomyces or it is nocardia. Nocardia. Only two things. Now already we told the difference. What Norafathy? Acid fast. Say acid fast. She is acid fast. Fast girl. Also second one we told paraffin bait. Paraffin bait technique. It's a special technique to isolate the nocardia. These two are negative here. So what is option here? Modified quinone stain. Modified quinone is basically, this is a acid fast stain. So acid fast stain is positive. So who is fast? Norafathy is fast. So I don't go further. I'm directly going to mark nocardia. That's it. Okay, because acid quinone is positive. Now, modified quinone is basically type of acid fast testosterone. Okay, like Zale Nielsen. So it's a cold method, basically called a cold method. So nocardia is correct. Okay, definitely not modular because this is fungus. Actinomyces out because it is acid fast. It's not acid fast. So it is negative. So nocardia is the only one acid fast and paraffin bed positive. Okay, that's it. Very, very simple. So no mistake in this question. So this is the exact picture which we got. Okay, next. Next question. Next question. The picture down itself already show. I can see only tell that it's a gonorrhea, something related with the gonorrhea. But let's see exactly what they are expecting here. Okay. Now you see here in this question, a 23-year-old man presents with the 2-day history of burning urine. Okay, burning micturition is there. Okay, and then he also reports a slight purulent urethral discharge. That's enough. So gentle discharge is there. He denies fever, malaise, etc. Yes, multiple sex partner, extend gently reverse only slight urethral discharge. Multiple sex partner. That is a source. It's the STD. WBC is 6,500. Urine analysis 5 to 10 WBC and no RBC. Okay, that's not important. Urethral discharge, gram stain showed neutrophil and intracellular gram negative diplococci. That's it. Okay, so it's more than enough. So with the urethral discharge, so it's very clear. It is a genital discharge, STD, genital discharge. With this urethral discharge showing gram negative intracellular, it shows it is gonococcus, Neisseria gonorrhea or gonococcus. Okay. Now, which is the best treatment regimen for gonococcus? You already know the drug of choice is ceftriaxone is the best. But because sometimes what happen, you can have usually this gentle discharge is always accompanied gonococcus plus chlamydia. Okay, the chlamydia which you cannot identify in the gram stain, you cannot see chlamydia, only gonococcus, because chlamydia is already an intracellular parasite and plus it is not a good staining. It doesn't have some important muramic acid structure, so you can't stain chlamydia. Okay, it has a virus like property, so you have to correct the chlamydia also. So ceftriaxone plus azithromycin should be the right option here. Do we have that option here? Let's check. Ceftriaxone plus azithromycin. Ceftriaxone IM plus azithro-PO each single dose. Perfect. Okay, that's the dose. So Oflo, no, this is not, Doxy, no. Doxy is one of the options you can give instead of azithro-doxy, they're giving, some places Doxy is giving, but definitely that is for chlamydia. For your gonococcus, this should be ceftriaxone. Then also one question that comes, in STD, increased resistance, antibiotic resistance seen in which means gonococcus only. Gonococcus is the, otherwise most of the STD disease you have good. For syphilis you have penicillin, herpes you have acyclovir, for chlamydia azithro is working, doxy is working, but the only thing where the resistance is very high is gonococcus. Almost all drugs are now failing. Okay, so that's what is important. Okay, excuse me one second. Yeah, okay. So this you have to notice. Okay, this is very, very important. Question can be asked from that. Okay, now next one. Hmm. Another important question. Yes, this is very important. The pictures also put it here. One picture always guaranteed because every time I'm seeing this picture. Okay. First of all, satellitism. So this I'll show the picture and then go. This is a satellitism. This is a satellitism. Satellitism. Why satellitism? You see in the center what they've marked. This is satellitism. First one once again. This is satellitism. This is camp test. This is camp test, and there is also of course reverse camp. And this is stalactite growth. They call stalactite growth. So three important diagram which you can have for exam. Okay, satellitism. So first of all, satellitism means you actually in the center you treat the staph aureus, and then on the surrounding region here, what you're seeing the growth, what you're seeing here is H influenzae. Okay, so Haemophilus influenza, what happened? The Staphylococcus aureus, it gives the NAD, it usually causes, it has factor hemolysin factor. No, so it gives the hemolysin factor and other factor. It's a hemoglobin factor. It gives all important NAD factor, NAD fat, etc. It's in the blood agar only, no? So it breaks this all hemolysin, breaks the blood. It gives NAD factor, and because hemophilus, so it likes the blood, okay, X factor and NAD factor. So Haemophilus, what happens? It grows around very well around the Staphylococcus aureus. Outside, not only here. So that satellitism is called Haemophilus, H influenzae. Okay, see. Camp test is again, what happened in center, again, Staph aureus you're going to put. Here, this one is for your group B Streptococcus. Group B Streptococcus, which is agalactiae, okay, which is causing neonatal meningitis, okay, one of the most common cause of neonatal meningitis. So this one, so what happened again, Staphylococcus aureus enhances the hemolysis, so you see an arrow, so that is camp is for this one. Excuse me. In reverse camp, what happened? Same thing only. So here what happened in the center, instead of staph aureus, you're going to put our Mr. Nagarjun, Clostridium perfringens. Clostridium perfringens. Okay, and then this will be same. This will be your group E only, group E streptococcus only, group E streptococcus. So again, you will see hemolysis here. So instead of staph aureus, you're replacing it with Clostridium perfringens. So you call it as a reverse camp. That's it. You call it reverse camp. Finished. Okay, same thing. And stalactite growth. I always say the shortcut. Stalactite means basically it's like the winter in the Himalayas, in the Kashmir in the morning time, the snow, after snow, it melts in the morning like in this, you see outside the house in the roof like this. That's stalactite growth. We always, I told, geese stall. Who has the geese stall? Our Vasen. Vasen is a Yersinia pestis. We talked about that, okay? So Yersinia pestis. Yersinia pestis. A lot of clues have given in the notes, okay? Yersinia pestis. Geestall owner is Vasen, is a special strain, but it's for Yersinia pestis. Okay. So now, satellitism means Haemophilus influenza. Okay, I also told Hemophilus, no, Hemophilus, Phil. So I told Phil, Michael Philip, no, Michael Philip has a satellite, okay? Michael Philip, the great swimmer, he's having satellite. Michael Philip, Olympic swimmer, he's having satellite. Told to remember like that. Satellite if you want. Okay. Stalactite, Geestall, who is having Yersinia pestis. Camp test is usually groupie Streptococcus agalactiae. Medusa head colony, you know, the goddess Anthrax. Anthrax goddess is having what a beautiful Medusa head she's having. Okay, so that one. Okay, sorry. Medusa head colony. So that is your this one. Simple. So expect one picture. Satellitism asked many times, camp asked few times. Stalactite growth, the name was given, but not the diagram. Okay, whatever they give, you're not going to make any mistake. Easy peasy. Okay, fine. So now A is 2, B is 1, C 4. Yes, fine. Okay, you got the answer. Very good. Okay. Next question. Now, another question. A 34-year-old patient come with a beef consumption, okay, in a restaurant presented with a bloody diarrhea, severe abdominal pain. Stool culture revealed one of the diarrhogenic E. coli. Yes, there was a diarrhogenic E. coli. Diarrhea was there, E. coli was there, okay, yes, and produced a pale, colorless colony in the sorbitol meconchi agar. Okay, this is enough. First of all, we will go in the order. The beef consumption, bloody diarrhea, severe abdominal pain means it's a dysentery. So it's basically dysentery. So when you talk about in E. coli, which variant causing this stuff, which it is EHEC, enterohemorrhagic E. coli is the one which is causing this. Okay, O157, O157H7 variant, which is almost similar to Shigella. Okay, EHEC is almost similar to Shigella. So, and of course, it is colorless in the sorbital meconchi agar. It is colorless because it doesn't ferment sorbitol. Okay, best describes. So, EHEC is the most dangerous variant. It's almost similar to Shigella. Shigella, that's what we call Shiga-like toxin. We call Shiga-like toxin. Shiga-like toxin. Okay. So that's what, because of the Shiga-like toxin only, this O15H1 causes, Hus syndrome, hemolytic uremic syndrome, and also hemorrhagic colitis. Hemorrhagic colitis. Two important thing it causes, right? So adherence to colonic mucosa? No, that's not directly. So toxin is the main part here. Okay. Here the toxin, EHEC toxin is the Shiga-like toxin is the main part here. That means this toxin inhibits the 60S unit. Okay, same like Shilanti. Okay, 60S unit. Adherence to small bowel, not that significance. No. Production of cholera, no, not cholera-like toxin. Shiga-like toxin, definitely yes. Then that's what it is causing. HUS and hemolytic uremic syndrome and hemorrhagic colitis. Okay, that's all. So this is your answer. Okay, so this is very important. So of course in E. coli, all the variants are important. Enteroinvasive. Enteroinvasive is usually an EPEC for pediatric. Enteroinvasive, the diarrhea is very much like Shigella, and ET is causing traveler's diarrhea. Okay, traveler's diarrhea. So these are a few things definitely you must Okay, you can't miss this part. Okay. So next question, sample of blood is found to be very infective in typhoid fever. Again, see the period for dengue and typhoid fever, which time, which test you have to do is very important. Okay. So here, when you talk about typhoid fever, it is caused by Salmonella typhi, okay, typhi. So we always say Salman, okay, Salman. Salmonella typhi, we are called Salman Khan. Salman Khan's doctor name who diagnoses typhoid fever is called what? Basu. His name is called Basu, Dr. Basu. Okay. So why Basu? When typhoid fever, we call B for blood, A for antibody detection, S for stool culture. It's blood culture actually. Blood culture, stool culture, and urine culture. Okay. Why this order? Because we are going to make it as like this. First week till first week, till first week, till first week. Okay. Then till second week, and then third and fourth week, till third week or fourth week, whatever the option is given. So for initial first week, the best test, okay, till first week, the best is this only. So till the first week, that's what Basu. Why? Because in the initial first week, the blood is the best one. So what is the question given here? Very infective. Infective means it is in the blood only. That is infective. That is the infective. No, blood means only infective. So it is during which week? First week. So till first week. So that's the correct. So when we talk about antibody, we're talking about a Vidal test. Till second week, okay, antibody will be better. Okay. After first week until till second week, the antibody test will be better. Okay, that's what they mean to say. Till first week, you don't detect the antibody, you will detect after first week only. So till second week, you can check for the antibody and Salmonella typhi antibody. So Vidal test positive. Okay. Excuse me, that's what they mean. Okay, second week is for Vidal. That's it. That's the indirect meaning to say typhoid fever. Okay, right. Now, typhoid fever, other things it is a stepladder fever. In typhoid fever, you have stepladder fever. And then relative bradycardia, another important sign, fever, bradycardia, and of course, rose spot, and coated tongue will be there. This is a common feature of typhoid fever. Okay. And then, yes, you can also, we missed something. Yeah, rose spot, coated then step ladder fever, relative bradycardia. Okay. These are the common signs. If the diarrhea is very rare, if it is there, pea soup diarrhea. We call it pea soup diarrhea. Like rice watery diarrhea, you see cholera, pea soup diarrhea in the Salman Khan. Okay, Salman. Fine. Next one. A 8-year-old boy, a 8-year-old boy admitted to hospital with the torrential rice watery diarrhea. It's a cholera. It's a cholera. So he was in the rural area where there has been a recent outbreak of this place associated with contaminated drinking water supply. What's the action? Okay, directly it is cholera. And we just already spoke about the different type of toxin mechanism. Okay, we break this rice water stool, rice water diarrhea means itself very fountain like free flowing diarrhea, and also it's a non-inflammatory diarrhea. Please remember, the cholera diarrhea is non-inflammatory. You don't see any pustules, no pus, no inflammation, no inflammation, so there was no any pus. That's what it is, just simply watery in cholera. Mechanism we already told, the mechanism cyclic AMP mechanism, ribosylation of ADP, ribosylation of cyclic AMP. Yes. So, but then here they didn't give about cyclic AMP, but instead they given something different. ADP ribosylation of stimulatory G. Because of stimulatory G protein only, you have diarrhea there, right? Opposite. So, if it's stimulating diarrhea, if it's inhibitory, there's constipation. So, this is more diarrhea here. Okay. So, it will be stimulatory ADP ribosylation. I'm just remember that stimulatory G protein. That's basically after this only cyclic AMP mechanism will come. Some exam cyclic AMP given, some exam the stimulatory ADP ribosylation of stimulatory G protein was given. Whatever it is. Okay. So, you know that. And these two, of course, the other one, you know, the first one answer should be either diphtheria toxin or it is the Pseudomonas toxin, diphtheria or Pseudomonas, only those two. Okay, inhibited G protein, no any significant here, other things not that significant. Okay, next test, yes, examiner's favorite. SAT, MAT, CAT, I always say important. SAT is standard agglutination test. MAT is microscopic agglutination test. VDL-RPR, you know, the VDL-RPR test. CAT is cold agglutination test. Collaboration test. So how to remember? The clue is always in classes we told. SAT means remember as a satellite. Not that satellite is some H influency. You remember like someone who's having a satellite. Who is having only a rich actor, a Chinese actor like Bruce Lee. Right? Only a rich actor like Bruce Lee can have a satellite. You know. Matt. What about Matt? Matt, we talked Matt Damon. Matt Damon, we told that he came to India and he saw that people affected from the leptospira people, he was taking them to his country in Emirates flight, right? Emirates jet, EMJH media, Korthoff's media, okay, Korea. He was taking them to Korea visa. Poor people affected with the rain lepto. Cat. Who likes a cat? Our always everybody's favorite princess, Diana, Princess Diana. That is, Princess Diana means it's if we told her skin is very much like a mycoplasma. Mycoplasma skin has a lot of cholesterol. Diana's skin has a lot of cholesterol. And same the mycoplasma fried egg colony. Diana also loves fried egg. And her favorite is cat. What is that? Cold agglutination test. So cat is for mycoplasma. So all the clues were given. So we're going to mark it. So SAT is a different very question. So Brucella. So when you SAT, use amount right here. Brucella. Leptospira, VDL RPR, you know, this is syphilis, characteristic very main, that is a main screening test, not specific test, non-specific screening test. Cat is for mycoplasma. Cat is a mycoplasma. So how to fill it? Brucella. Brucella causes what disease? Undulant fever. So in undulant fever, which is the best undulant fever or Mediterranean or Malta fever, whatever, you have so many names for brucella fever, undulant fever, very similar to typhoid fever. Okay. MAT. MAT is, we just told, leptospira. Leptospira causes Weil's disease, of course. You know that. Weil's, leptospira, Weil's. Okay. VDL RPR for syphilis. You know this one. I don't need to tell it also. So it's already there. Okay. Syphilis. Sorry, excuse me. Okay. So, yes. So, one second. And so, cat is mycoplasma. So, mycoplasma causes the walking pneumonia, right? Okay, so we got it. So, A goes to your A should be 4, A4, B1, C2, C3. Okay, so don't forget cat, mat, and cat, mat, and SAT. Okay, very important. VDL, RPR, syphilis. So no need to tell only. Okay, fine, very good. Now, next question here. Another important question here is, of course, 49-year-old man with a chronic fatigue, headache, fever, and muscle pain, joint pain. Okay, he described initial rash was central circular rash with central clearing. Okay, and reddish spot, quite large, and then appeared to be faded away. Okay, the symptom developed 4 days, month, no apparent cause. He gradually got recent addition of musculoskeletal pains. What condition is causing this patient's symptom? Okay, right. Okay. So this is a very clear rash. So it's again medicine question also. A red circular with central clearing. This is like this. The rash is like this. Okay. So this is also called target lesion. We call it as target lesion. The skin lesion, target lesion, or which is also called erythema migrans. Erythema migrans, and you know this bull's eye target lesion or bull eye lesion, different names. Okay, bull eye lesion. So they it developed 4 month ago. Yeah, 4 month ago with no any apparent cause. He doesn't even know where it came, and started with the musculoskeletal pains also. That is very classic for this erythema migrans. You know where? Lyme's disease. Lyme's disease. So when you pour a lime juice, I always told, when you pour the lime juice on the skin, the lesion will migrate. Okay, the lesion will migrate. Excuse me. The lesion will migrate. Okay, that's what how you're going to remember. The lesion will migrate. So that's the way how you're remembering it. Okay. So Lyme's disease, erythema migrans, Lyme's disease. Okay, easy. So Lyme's disease. That's it. There is no any other clue. So it's easy. So headache, fever, it's almost very much similar to your rheumatic fever only, except that the rash is different here. Erythema migrans. You know, in acute rheumatic fever, it should be erythema marginatum. Erythema marginatum. Here it is migrans. That's all. Okay, fine. Match the following. Again, I told you vector is very, very, very important. Okay, so you can't miss anything with the vectors. Louse. I always say whenever we talk about louse or lice, everybody's head, no, all over the world, everybody's head you have lice. Okay, the head, everybody's head has lice. So that means anything epidemic comes, epidemic word, you have to mark lice. So do I say anything here epidemic? Yes, I'm saying epidemic typhus, not only epidemic typhus, even epidemic relapsing fever. Epidemic relapsing fever is also your louse only. Okay, tick. Tick, tick, tick. This is a rocky mountain. We told rocky mountain. Whenever you climb on a mountain or when you go to forest like Lysnore forest, what happened to your heart? Your heart will say tick, tick. Your heart will say tick, tick. No, it's very scary, inside the forest and the mountain. So tick, tick. So rocky mountain. So tick, tick is rocky mountain. Okay. Might. You know that. Who does a mighty hand wash? Who? Our Trump. Our Trump, what happened? After scrubbing his hand, he do a, after urine, what did he scrub his hand mightily, okay, might. So, might means scrub typhus, which is called trombiculid mite, okay, the sugar rushes. Unpasteurized milk, who drinks queer means, LGBT people, they drink unpasteurized milk to look themselves very beautiful. Because, in Q fever, there is no vector, no rash. No vector, no rash. It's because of drinking the unpasteurized milk. Okay. So you got the clue. These all are important. You can't miss anything here. Okay. So now, 1 is C and 2 is B. 1 is C, 2 is B, 3A and unpasteurized milk. You can't miss. Remember, queer fever means queer means LGBT community people. They drink unpasteurized milk to look beautiful. Unfortunately, they get Q fever. Otherwise, they do have no vector, no rash. Okay. And might scrub, mountain, tick, tick. Okay. So this all important things you should know. Very important. Okay. Right. Next one. Wrong about the bacterial vaginosis. Bacterial vaginosis, BV. We call it as a BV. BV. How to remember? BV in Hindi is wife. Wife, what happened? Wife has a clue. She has a clue. Her husband is whiffing or sniffing. Okay, he's whiffing another girl. He's whiffing with another girl in vaginal garden. In the vagina garden. In the vagina, the garden name is called vagina garden. Okay, got everything is here. Okay, so BV, bacterial vaginosis. The disease name is bacterial vaginosis. Clue, the identified best cells called clue cell, catalytic cell. Okay. This is when you put, and then of course you have to do the pH. If you check, it is will all be more than 4.5. Yes, that is the Amsel's criteria. You do a criteria called Amsel's criteria, and Nugent's criteria is for the microbiology criteria. Okay, that's fine. And you see what whiff test positive. There's a test called whiff test, that is KOH test. When you add 10% KOH to the vaginal secretion, there will be smell, foul smell. The foul smell will increase. Okay, foul smell will increase. Why did we say garden? The causative agent is Gardnerella vaginalis. Gardnerella vaginalis. Other one, Mobilincus. Mobilincus. Okay, so this is a characteristic name. And of course, they have grayish, thin gray, white dish. Thin grayish is not white, thin grayish, foul smelling, fishy, foul discharge. Fishy, foul smelling discharge. Okay, so that's what. So discharge offensive smell, correct. pH more than 4.5, correct. Causative agent climate recommended, wrong. Why? Because the garden, okay, vaginal garden, husband. See, BV is a wife, has a clue, husband is sniffing or whiffing another girl. Okay, so whiff test, clue cell, garden mobilicus. Clue cell is also correct. Okay, easy question and expert question. You have to expect question from that topic. Okay. Fine. Okay. Now we're done. It's okay. So most of the bacterial important topics you have covered. Okay. That's actually a good idea. What we did was very good. Now let's go to a little bit of immunity and then general microbiology. That's it. Okay. Just under 20 questions. It's going to be very informative. Yes. First of all, when you talk about hypersensitivity reaction, you know the clue is very simple. Type 1, when you talk hypersensitivity reaction 1, it's all the allergy and parasite. Okay. Any allergy and parasite. Any allergy and parasite. Hypersensitivity to reaction, the all shortcut you have to know is my blood group is RH, my blood group is RH positive. Hypersensitivity 3, you should know 3 means it's like a 3, like a threshold. So this is a sharp metal. It's a sharp metal. Sharp metal. And hypersensitivity reaction 4, that's a delayed hypersensitivity reaction. So they have a lot of diseases like, a lot of autoimmune and advanced diseases will come there. And all the most of the graft reactions, most graft reaction, except hyperacute. Also, don't forget important test, lepromin test, tuberculin test, freeze test for chlamydia. I mean LGV, freeze test for chlamydia, and Montenegro test, Kalaza. So all important tests will come here. Okay. Here in type 1, only one test, that is your Cassoni's test. Type 1, you will think about Cassoni's test. Okay, that's it. This is only shortly if you want to say about hypersensitivity reaction. Let's fix now. Any anemia, okay, anything related with the blood, okay, anything related with the blood, hemolytic anemia or pernicious anemia, RH incompatibility, all these things will go to type 2 hypersensitivity reaction. Okay, that is cytotoxic hypersensitivity reaction. Okay, yes. Cassoni, we know. Cassoni means type 1, allergic hydatid cyst. We already spoke about it, hydatid cyst. Serum sickness. Did I say any yes here? Yes, I'm saying yes here. Yes in type 3. Because your SLE and also serum sickness. SLE and serum sickness comes in type 3. So I'm going to put type 3. Chronic graft. I told most of the graft rejections will come here only. That means your acute, your chronic, and graft versus host reactions, all except hyperacute, because here hyperacute will come here. Hyperacute graft rejection is here. Hyperacute graft rejection, hyperacute graft rejection will come in the type 2. Okay, so this is a chronic one. So chronic is type 4. Very simple. No mistake in hypersensitivity you cannot make. Okay, it will be a big mistake, blunder. Okay, so now let's mark. 1 goes to 2, A2, B1, fine. 3 and D4. Okay, easy. No, so remember this clue. It's in my other videos also. I'll send this PDF also, don't worry. Okay, fine. Viscott-Ullrich syndrome, all or two except, in whenever you talk about immune deficiency disorder, we have like this. We have, I'm writing here, we have phagocytosis disorder. I'm sorry. Oh, I'm supposed to write here. 1 second. Hmm. Yeah. So we have different type of disorder. One is phagocytosis disorder we have, and then we have B cell disorder we have, and then we have T cell disorder we have, and then we have combined. Combined means both T and B cell together. Okay, T and B together. So in combined cell, there is this. I always tell students to remember. Sid, this guy Sid, he combines whiskey, whiskey with water and gets ataxia. Ataxia. Okay. So Sid because severe combined immunodeficiency. Whiskey, Wiskott-Ulrich. The disease is Wiskott-Ulrich. Rich, okay. Ataxia telangiectasia disease. Ataxia telangiectasia. And see this severe combined immunodeficiency. So these three are combined immunodeficiency disorders. Very simple. Okay, that's the clue. So now we are talking about Wiskott-Ulrich syndrome. The shortcut to remember Wiskott-Ulrich syndrome is very simple to remember as water. Water Wiskott-Ulrich disease. T for thrombocytopenia. Thrombocytopenia. Okay, penia. And then E for eczema. Eczema. R for recurrent infection. Recurrent infection. That's it. Now what I'm going to see, we see the options. Thrombocytopenia, yes, correct. Wiskott-Ulrich, I am seeing here W. W is for me more like M. So IgM decreases and A is here. IgA also decreases. But what I'm seeing here, I'm seeing IgE not relevant at all. That is the correct answer. Okay, correct answer. That means wrong answer. Answer here is wrong. Except, no, just except. Defective response to bacteria, definitely yes, because your all cells are going down. The main reason is combined. Both T cells and B cells are going down. So it's correct. Prone to develop, yes, cell lymphomas can happen in some cases. Okay, fine. That's what. So before that, I write this also. When you said phagocytic disorder, there are two. One is a chronic granulomatous disease. Other one is a Chidiac Higashi. Chidiac Higashi. Higashi syndrome. Okay, chronic granulomatous and Chidiac Higashi. B cell disorder, it's usually Bruton's A gamma globulinemia and also IgA deficiency and hyper IgM disorder. Okay, T cell, that is your classic DiGeorge syndrome. DiGeorge syndrome, thymoma, no, thymoma, catch 2022, that disorder, DiGeorge syndrome, and also of course you're going to add mucocutaneous disorders. Okay, T cell related mucocutaneous disorder. That's it. Okay, fine. That's it. Candida infections comes there. Okay. Now, next question. A child presented with the recurrent staphylococcus infection, okay, abscess or something, and diagnosis very low level of immunoglobulin. All the immunoglobulins have decreased and B cells also decreased. What is the most likely diagnosis? Definitely, it is Bruton's agammaglobulinemia. Okay. What does it mean? It's a X-linked. It is a X-linked Bruton's agammaglobulinemia. So there is this pro B cell which is converted into the pre B cell, and then that is converted into your plasma and B cell, plasma cell and the B cell. This is the usual sequence. There is an enzyme tyrosine kinase. Tyrosine kinase here. So this is gone. And this is X-linked, so it is boys. After 6 months, after 6 months only, what happened for the boys, the infection happened. So usually because the X-linked we said, so it's boy. So pro B cell converted B cells decrease. That means when this is going down, all will go. Decreased B cell. So that is because plasma all goes down, decreased all immunoglobulins. All the immunoglobulin GAMD all will go down. So that is Bruton's. Whereas in common variable, what happened? You have cut in the, here will be your pre-B cell. It's not converted into plasma cell. Here the problem will be here. Okay. So here what happened? The symptoms will manifest not severe. It is not severe. And it will manifest after 20 years only, not immediately. It will manifest after 20 years. Okay, so that's the one clue. So that's not that dangerous. Okay, so this is the one you're seeing. Okay, DiGeorge is a T cell disorder, so no any link at all. Hyper IgM should go high. IgM will be increased, not decreased. So this is the difference. Okay, Bruton's is the common one. Okay, B for Bruton, B for boys. And it's a B cell disorder. Again, B cell disorder. Everything is BBB here. Okay, everything is BBB. B cell, boys, Bruton. Okay, very simple, no mistake. Okay. Now, a 7-year-old child with a recurrent bacterial fungal infection is there, and recurrent abscess and lymph and all infection is there. Dihydrorhodamine test is abnormal. That's it. That's more than enough. Okay. This is the test, main test for you to distinguish. This dihydrorhodamine test comes abnormal means itself you have to think about which one dihydrorhodamine test is means if you think about a chronic granulomatous disease. Chronic granulomatous disease. You know this one. What happened in chronic granulomatous? You have NADPH oxidase deficiency. Oxidase deficiency. Because of that, phagocytosis defect. Phagocytosis defect. And because of that, there is increased, increased infections, especially bacterial abscess, increased abscess, everything will happen. So that's what you're using this test called dihydrorhodamine. Repeatedly asked question. This test will be abnormal. Okay. Dihydrorhodamine test. That's it. Okay. Yeah. That's it. Then match the following. This all different. The severe combined is different. This all are different. Severe combined where both T cell and B cell be decreased. That's not here. Okay. That's not come here. That again there the defect is basically because of cytokine 2 receptor defect or adenosine deaminase defect. These are the common reasons there. Okay. There are multiple severe infections. So we're not going to bring that here. Yeah. Graft reaction, you know that autograft is the own graft. So usual autograft is usually skin graft. Xeno means another species. So it's a transfer between different species. Allo is the most transplant. That means most transplant, not most common transplant because skin is the most commonly done, but most different variety of transplants like bone, your liver, kidney, everything is from different patient. No, allo means different patient, different person, same species. Different person, same species. So that is most transplants are like that only nowadays. Yeah. ISO is a twins. ISO means identical twins. Okay. I means identical twins. So that is correct. So A should be 4, A4, B2, and fine. C1, D3. Okay. So simple. So auto means own body. Xeno is new species. X means new another species. Allo is the most common. Allo is the different variety of things you can do. Take from other patient and you're grafting. Okay. So that's most common one. Isograft is identical twins. Okay. Twins. Okay. Now, which of the following antigen presenting molecules found on all nucleated cells? Yes, this is only, when we talk about MHC or MHC 1 and 2, we have 1 and we have MHC 2. MHC 2, I always say 1 means, remember, one cell has one nucleus and one cytoplasm. Like this, you remember, it's easy. Why nucleus? All nucleated cells. All nucleated cell except that RBC and spermatozoa, sperm cells. Okay, they don't have this one, MHC1, number one. Number two, cytoplasm because cytosol pathway. Everyone goes cytosol pathway here. The mechanism is cytosol pathway for antigen presenting. Okay, fine. Two, I told Andhra Pradesh became two state now. Andhra Pradesh became two state. That means antigen presenting cells. All the antigen presenting cells. Antigen presenting cells will be MHC2 presenting the testing. So now because it is all nucleated, I have to go mark MHC1. Very simple. No mistake. Nothing. Easy peasy. Okay. MHC1 or HLA1. They're same only. HLA1 you call human leukocyte 1, human leukocyte 2. They all are important for doing transplant reactions for those things. Okay, that's what you're writing here. Okay. Okay, fine. Now, next one. Relevant option. Of course, immunoglobulin, all important topics only we have chosen. Okay. The most abundant immunoglobulin is IgG only. And this is the only G means God. Only God can cross even the placenta. I told you, remember like that. So G. Of course, don't forget it's for chronic infections also. All the chronic infection crossing placenta is G. And of course, doing most of the opsonization reaction. Opsonization, of course, augmentation, but opsonization very specifically IgG is very important. Okay. IgM is the only one which is pentamer, which has 5. If you remember the chain, 5 chains are there. Okay, 5 chain. A is dimer. This is another previous year question. A is a dimer, especially A2 is a dimer. Okay, so remember like this A. So 2 is there. 1 and 2. So dimer. A is dimer. Okay. E, you know, helminthic infections. E is allergy and helminth or parasitic infection. Okay. So the same only, doesn't matter. So G goes to 2. Okay. G, A2, B1, C is 3, D is, and then of course your D is D only 4. Okay. Fine. Okay. Right. Now, next question. You have to match the following. Okay. Now you see here, it's a repeated and important question. You should know. C3, C5 membrane attack complex and DiGeorge syndrome, severe combined immune, and C1 esterase inhibitor deficiency. What is it causes? C5-9 membrane attack complex leads to one important infection, Neisseria. Neisseria meningitis especially, but Neisseria is fine. Membrane attack complex, that's called MAC complex also. We call it as a MAC complex defect. MAC complex, the final pathway. So Neisseria infections are common, especially meningitis, especially meningococcus. Gonococcus also, meningo more. DiGeorge syndrome, DiGeorge, we know that catch 22. 22 chromosomal defect in 22q11. C for, you know, cleft palate. A for abnormal face. A for abnormal, I'm sorry, 1 second. A for abnormal face. T for thymoma. That is, thymus defect, not thymoma, thymus defect. Okay, so T will go down. C for, you know that what happened? Calcium level goes, no, this is a cardiac defect. Okay, cardiac defect. H for hypoparathyroidism, hypo-PTH. Those things. Okay, that is for your DiGeorge syndrome. I told shortly, this is the one you should know. Okay, cleft palate and all things. Severe combined, you know, I told that just before I told adenosine deaminase, but of course the main one is due to cytokine 2 receptor defect. Also, you have RAG gene, RAG1 and 2 defect, RAG1 and 2 gene defect also, other things which can add. Okay. C1 esterase, you know, Esther has what? All swelling. Esther has all swelling. To remember, Esther, she has all the swelling. So she got what? Hereditary angioedema. Okay. Because complement system overactivated because there is no inhibitor. So you get this one. Okay. So A goes 4. A4, B1, A4, B1, C2, C3. Finished. Very, very simple. Okay. Clue. Everywhere is a clue and easy. Of course, there is no exam without growth phase. Okay. You know that when the growth phase is always start like this, is a lag phase, log phase, stationary and decline. Okay. So this always start with lag. A4, lag. Then comes the log phase. Then comes the stationary phase. Then comes the decline phase. Lag is like lazy phase. So what happened? You eat, and whatever, just the cell size increases. Bacteria cell size increases. That's it. Okay, size increases. Log phase is basically active college phase. It's like you're going to college. So in college, what you have to do when you go to microbiology, you go into gym and fit trim. So your size decreases, but the number increases. Size increases, but the division increases, so number increases. That means what are important here? You're going to do biochemical for all the biochemical test, staining, etc. This is the best phase. Okay, yes. What about stationary? Stationary is yes. So spores, granules, spores, storage granules are formed here in S phase. Okay, that's it. So basic I told. So lag phase, maximum cell size, very good. Log phase, you have to do cell divides exponentially, correct. Stationary phase, that's what log phase also called exponential phase. Stationary phase, yes for yes, yes for storage granules, correct. Even if the word spores given, that is also correct. Also toxins formation also in the stationary phase only. So that's all correct. Okay. Decline phase is involution phase. Very simple. Not at all to, you know, just everything is there. Clue. Okay, easy. So don't miss these things. So A for maximum size, A goes to, B comes 4, C1 and D3. Fine. Okay, we're doing very good. Okay, oh, very good. Now we are finishing. So general part now. Okay, so now next. Match the following acid first bacteria and the sulfuric acid is important. You should know it. Okay, you can't miss it. So there are 25% sulfuric or 5% 1 and 0 to 0 0.5. This is not 0 0.1. This is not 0 to 1. This is 0.5% H2SO4. 25 means itself, it's 20 or 20%. Okay, so we always say T20 match, right? 5. Always the word total 5 letters is there only in lepra. 1, 2, 3, 4, 5. Lepra. 1, many parasites. 0.5, yes, is somewhat like 5, you know, 0.5. Okay, clue. So you already know now. 25% T22 means we're talking about the TB. Is there anything TB? Yes, correct. Fever, chronic cough, weight loss. That is for TB. Very good. Okay, I made questions like this, so it's like triple revision. You know the percentage, you know the bacteria and the disease also. So you'll be multiple super revision for you. Okay, which will be very helpful for you, I'm sure. Okay, now 5% is lepra. Do I see any leprosy? Yes, I'm seeing an hypopigmented macular. This is basically TT form of leprosy. TT form, TT, TT, LL, lepromatous tuberculate form. So tuberculate form. So this one, correct. 1%, diarrhea and immunocompromised, that basically cystis. Cryptosporidium, cyclospora, and isospora. Cysto-isospora, basically cysto-isospora. Correct. 5 is spore. Yes, that's it. Okay. So A3, B1, A3, B1, C2, Jason. Correct. Perfect. Okay. 61, your answer is B. You got it. Fine. Next. Match the fluorescent stain and the respective organism. So first one is your rhodamine. Rhodamine means it's of rhodamine means it's of, we told, Mycobacterium tuberculosis. Okay. Mycobacterium tuberculosis. Mine, auramine and rhodamine. So this is Mycobacterium TB. Calcofluor white. Anything white, we think about fungus. Most of the fungus. Okay, fungus, white. Acridine orange, we told orange you have to give to malaria patient. Your friend, Moto, you call it as the Kawamoto technique, Kawamoto. You give to your Moto friend, malaria, orange. Fluorescent temperature, this is basically for cytometry. We are using this to check the cell counts. Okay. So auramine, rhodamine, what I'm going to say here, the organism has a lipoarabinol in it. Definitely yes. That is, lipoarabinol is the main valence factor for your Mycobacterium tuberculosis. Another question. Calcofluor white is a fungus. So do I see any? Yes. Fungus is the one that has chitin layer. Another question. Chitin is very characteristic for fungus staining. Okay. Yes. What about the orange? Malaria. Do I see any malaria? Yes. Malaria is transmitted by Anopheles mosquito. Definitely yes. Correct. Okay. You got it. So that's also fine. Perfect. Excuse me. Yes. Okay. Excuse me. Hmm. Okay, now acridine orange malaria. What about the fluorescence isocyanate? When you talk about fluorescent isocyanate, you're going to, what happened? You're going to check the fluorescent isocyanate. It is the cytometry. Flow cytometry means you're checking for the CD4 cells. So CD4 cell, what I'm looking, HIV patient lymphocyte count. That is basically, in HIV, the main cell affected is CD4 T cells, right? So that's the thing. Got it. Everything is different type of questions discussed now. Okay. Auramine, rhodamine, TB, and calcofluoride stains are very important micro. So don't forget, these are fluorescent stains, important fluorescent stains. So A4, B1, C2, and D3. Okay, good job. Now we're talking about the selective medias here. We're talking about the selective medias, excuse me. So now selective medias. What are the selective medias and the bacteria? Medium is a very, very important. So what are the clues you remember? Let us see. We have potassium tellurite. We always say that tell interns, not tell interns not to loaf around. So potassium telluride and loaf around, where in which ward? Diphtheria ward. Okay, in diphtheria ward, tell interns not to loaf around diphtheria. Thyre Martin, Martin's, the girlfriend of Martin is Nisha. Neisseria. Neisseria's boyfriend is New York, Thyre Martin. He's from New York. Okay, New York, Thyre Martin. You already are getting all the clues now, so don't worry. Cetrimide. Who is always ready in the movie set? The movie set means if there is only one female woman, she is dominating the TV industry. Of course, our Ekta Kapoor. Ekta. So when you say Ekta, you always remember Pseudomonas, right? Pseudomonas. Ekta Kapoor means it's of Pseudomonas. See, this is the way how easy it is. I don't have to mark anything. Movie set remind agar. So it is Pseudomonas, Ekta Kapoor. Then Lowenstein LJ media, we repeated many times. You shouldn't go without knowing LJ media to your exam. TB. Okay. Now, so first one is diphtheria. Is there anything that's suiting in the diphtheria? Of course, yes. I'm seeing a beautiful pseudomembrane in the throat. So potassium telluride for pseudomembrane diphtheria. You have to put it there, which is a potassium telluride is a selective media for diphtheria. Another one is a Loeffler serum. This Loeffler is basically Loeffler serum, which is a enriched media for your this one, your diphtheria. Okay, so that's what is important. Thyre Martin, of course, Neisseria, gonorrhea, this thing. So gonorrhea, faithful. So gonorrhea, Neisseria, gonorrhea. So I'm using Thyromartin or New York media. Both are correct for gonococcus. Okay. Cetrimide agar is for ectocopper. Ectocopper has what? Of course, malignant autism, a very repeated question. I think 6-7 times repeated question. In diabetic mellitus patient with malignant otis externa, which is the most cost efficient, of course, Pseudomonas aeruginosa. And the selective media, Cetrimide agar. They can ask you question anyway. That's what we're grilling like this. Okay. Super grill we are doing now. Okay. We're just grilling and drilling and making ourselves very strong. LJ medium, TB. TB means chronic cough, weight loss, same symptom. That's it. Simple. So easy peasy, So no way you're going to say that micro stuff hereafter. Okay. So A4, B1, A4, B1, C2, C2, and then D3. That's all. Okay. You got it. Next one. Again, culture media. There's no culture media, there is no micro exam. Okay, because culture is the main thing for micro. It's a gold standard for micro. So you have to expect all this media. This all of it, any 1 or 2 media definitely will come. For Fmge student, that could be the thing that they get 150 and pass or to get good rank. And for other people, Inicet and of course Neet PG, of course, this is a very important for good rank. You have to write this correct. Okay, right. Now, Pike's media. Whenever you say pi, the word pi, we always talk about Streptococcus pyogens. Okay, Streptococcus pyogens we call. Okay. Now, we are Venkatraman and Carryback. Who is Venkatraman? These are the Viba Darling. These are Viba, I'm going to write here. Viba Darling's car driver. Viba Darling, Vibrio Kalra. You know that her car driver, Venkatraman is a car driver and transport media. And whenever Viba is going out, she carries what? Carry bag with her. Carry bag with, of course, don't forget seawater, autoclaved seawater. She doesn't drink normal water, seawater while traveling. Okay, transport media. So you already got that. So I'm talking about Vibrio Cholera, Viba Darling, darting motility, Vibrio Cholera, this thing. Okay, sacks buffered. Okay, who wears the socks? Who wears the socks when they go outside? Of course, the Salman and Sheila auntie. You know that Salman and Sheila auntie. Sheila, whenever they go out, they wear socks. Okay, so that is Salmonella, Typhi, and Shigella. Whatever it can be, let us see what option it comes. Let us see. Emis media. Emis is a transport media for your, this is all transport media. Of course, everything is a transport here. We're talking about the transport. This is all our transport medias here. Transport media. Okay, so transport ME is for gonococcus, especially for Strouds and MEs you call. So let's see, Pike's media. Pike's media directly mentioned Streptococcus. Fine, very good. Streptococcus pyogenes is better, but okay, doesn't matter. Venkatraman and Ramakrishnan, of course, Viba darlings. Sack, who wears a sack? Sheila auntie and Salman. So if option Salmonella also correct. Salmonella. Okay, correct. M is for Neisseria gonorrhea. That's a simple. Why to waste your, you shouldn't waste time. This is not tick, tick before exam. No, you should go like that. Okay. So, A3, B4, A3, B4, C1, D1. Okay. I'm very confident if you're going through this thing, a lot of students going to make a big difference in their exam. Okay. So, if you have time, just go through it properly. Okay. It's very important. Now, next one, type of sterilization and the items which are used. Of course, sterilization is microbes' main topic, so you can't miss it. So, liquid. Now, I'm not even going to the option. I'm going to just write here anything liquidy, anything sharpie, anything dusty, okay, anything dusty, powdery, all this okay, liquidy, dusty, powdery. Those things go to hot air oven. Liquid, paraffin, liquidy, dusting powder, gloves, dusting powder, anything sharp instrument. Okay, culture media. Culture media means it's for autoclave only. Okay, for micro, we use autoclave is the main thing for us. Okay, and sugar containing media, sugar is usually stored in where? In tin. We told mom, she put it in the tin, 10 into 10, tin and 10 into 10. 10 because 100 degrees Celsius, and we put sugar in the tin. So tinderization is sugar containing media. Okay. Inoculating loops, of course, automatically it goes to the red heat. That we know. We know that you put red heat, fire, and then you put the loops and wires here. We told. Okay. So that you know. So A goes to 2, A2, B4, A2, B4, C1 and D3. Perfect. Okay. Good, no? Good revision. Temperature, again, very, very important. No mistakes in temperature. So how to remember? First of all, tin, tin means itself 10 into 10. We told, remember, 10 into 10. So 10 into 10 will be 100. So 100 degree for 20 minutes, 3 consecutive days. Okay, intermittent. I'm coming to inspection. Inspection is also intermittent, 3 days, but only thing temperature will be a little bit low, 80 to 85. Okay. Tyndallization 10 into 10, 100, 10 into 10, 100, 10 into 10 is equal to 100. Okay, so 10, 10. So inspirationless. Hot air is the maximum. Among common things what we're using, the maximum temperature is this only. 160 for 2 hours. You know it very well. Okay, and autoclave is little bit low. 121 degree for 15 minutes. Okay, 15 minutes. 121 for 15 minutes. Okay, because it's in the steam. Right. Now, options. A goes to 4. A4 and B1. A4, B1, C2, D3. That's all. Okay, very, very simple. So these are the 4 important temperatures in sterilization. You know it. What about biochemical indicators? Of course, expect. Definitely you should expect a biological indicators. Okay, this is a lot like expect. There is no way you're leaving this. There's no way you're missing all these topics. Okay, you should go. So now, let's do this. For plasma sterilization, you know plasma and autoclave, it's the same. For plasma and autoclave, same biological indicator. Bacillus stereothermophilus standard. Okay, no forgetting. Plasma is to stereothermophilus. The name itself says steam. So steam means it's autoclave only. No, autoclave is a steam only. So stereothermo steam. Okay, okay, fine. Hot air oven. Hot air oven, I always give you clue. Please remember hot tea, hot roti, atta roti, hot atta roti, hot atta roti, and hot sabji. Hot sabji. Okay, sabji. So tea because Clostridium tetani, you know Clostridium tetani. Atta roti, this is Bacillus atrophius. Bacillus atrophius. Sabji, Bacillus subtilis. Bacillus subtilis. Hot tea, atta roti, sabji is a clue. Okay, subtilis. So do I see any of these things? Yes, I'm seeing a Clostridium tetani. So I'm going to mark Clostridium tetani. Okay, Clostridium tetani. Eti. Now let's go to Eti. Dr. Eti, you know that Dr. Eti, she's my friend. She's working in ICU. Her favorite things are respirator and heart lung machine. Heart lung machine. And dental equipment, that's okay. The respirator and heart lung machine important. And what happened at home? I told at home she cooks something for her family. What is her favorite thing? She doesn't like tea. She doesn't like tea. Please remember tea, hot tea. It's not, she doesn't like hot tea. Forget about it. But she likes atta roti, definitely atta roti. And of course, she has to make what? Gobi sabji. Gobi sabji. Okay. Gobi sabji. So, atta roti, Clostridium, this is of course Bacillus atrophius, Gobi, Bacillus, Globigi, okay, Globigi, Bacillus subtilis. Bacillus subtilis and atrophius is common for both hot air oven and this one. That's fine. Okay. So do I see any of these three? Atta roti, sabji, and gobi? Of course, I saw ethylene oxide gobi. And also don't forget G for gobi, G for ethyl leaves gas. So gas sterilization. We also call it as a gas sterilization. Okay. Again, Dr. Eti leaves because of eating gobi and sabji. She leaves gas, lot of gas. Okay. Annual gas. That's so fun only. Okay. So she's going to kill me now. Okay, so if goes, okay, fine. Now what about filtration? Filtration, use the brew filter coffee. Best coffee is brew filter coffee. Brew filter coffee is the best filter coffee. Okay, brew filter. So Brewendi monas, everything there's a clue. Very basic, easy clue. So no mixing ups. Okay, so this was repeated. You know, indicator you check, open your previous books and say at least 10, 15 times questions are asked. So this is, I made it super short for you. So you're going to remember. Eti means she cooks tea. She doesn't like tea, but she likes what? Atta roti, gobi sabji. That's it. But hot what? Hot tea, hot roti, hot tea, hot atta roti, and then hot sabji. That's it. Okay. That's it. There is no gobi there. Here gobi will not come. Hot gobi will not be there. Okay. Okay. Fine. So your answer is A is 3, A3, B4. Fine. Okay. And C1, D2. Fine. Excellent. Okay. We're doing good. Almost we're finishing now. Match the sterilization method with the articles to be sterilized. Yes. Okay. Sodium hypochlorite, this is the main disinfectant in the spills. Hospital spill and also any spill comes, spill, sodium hypochlorite. 0.5%. That is fantastic. Eti, I just told, Dr. Eti. Dr. Eti, she works in ICU. No, she's an ICU girl. So definitely heart lung machine or respirator also. Respirator. Okay, it's masks, you know, N95 or she wears N95 mask and a respirator. So those things, okay, and heart lung machine. Rad means it's a sterilization by free radicals. So free radicals means it's a, that is plasma. Basically, this is a plasma radiation. This is a plasma. Rad is a plasma radiation. It's a plasma radiation. So for arthroscope, I always say how to remember arthro, especially arthroscope, artho and urethroskop, arthro and urethroskop. Okay, artho and urethroskop, this is the best. Okay, so gamma rays, G for gamma, G for gut, catgut sutures. Catgut sutures not lethal, sometimes gloves also. You can sterilize the gloves also with the gamma rays. Okay, that's it. Catgut and gloves. Okay, so A goes to 3, A3, B4, B4, C2, D1. Okay, very good. Easy, easy. How easy it is. Okay, you can't miss anything. Yeah, now these questions are becoming popular. Microbiome TB. Microbiome TB is basically this recently asked question. So for TB and COVID, we use biosafety level 3. 4, they might ask for Ebola. Ebola is very risky. Ebola and Marburg are very risky ones. So you have to use this. Rest all regular bacteria. So you don't have to worry. Okay. This is normal. They didn't ask. Simple. All salmonella, E. coli, staphylococcus. We do with this normal thing. Okay. So nothing to worry there. Okay. Fine. Now, I think almost just two questions left. No? Yes. Yeah. Almost we're finishing now. All of the following comes in the bioterrorism category. Yes, bioterrorism category frequently students were asking. Bioterrorism one is the most dangerous category. B and C nobody asked. Bio category A is very important. So for this, all you have to remember is Amitabh Bachchan. Amitabh Bachchan. Amitabh Bachchan recently, you know that Amitabh Bachchan had, you know what he had? Amitabh Bachchan had PSVT. Okay, PSVT, paroxysmal supraventricular tachycardia. Amitabh Bachchan A for anthrax, B for botulinum, P for plague. They are bioterrorism category 1, very dangerous ones. Smallpox, viral hemorrhagic, virus which is causing hemorrhagic fever, viral hemorrhagic fever. That is especially again Ebola will come here. That's what it's dangerous. Ebola and Marburg will come here. Viral it is. And T for tularemia. Tularemia. Okay, that's it. Amitabh Bachchan got paroxysmal supraventricular tachycardia. Okay, you can add this. Sorry, he got also. Amitabh Bachchan got. G for glanders. Glanders is basically Burgholderia. They don't ask much. Burgholderia Malai. Okay, Burgholderia Malai. Malai. Okay. Fine. So here what I have now, but except they asked except. So anthrax I see, botulinum I see, plague I am seeing. Yellow fever, no. Yellow fever doesn't have any link. Okay, that's it. Very good. Now, last question. A 20-year female present with the symptom of UTI on culture, lactose fermented, isolated, and biochemicals of E. coli. Okay. Which of the following is false about the E. coli? Okay. Here the question is all about gram-positive and gram-negative bacteria. First of all, you should know gram-positive and gram-negative bacteria. What is important here in gram-positive bacteria? The most important negative people, negative people, negative people. Negative people, positive people, they do PPT. PPPT. Positive people, they are usually purple color, purple. They have polypeptide, thick polypeptide. Polypeptide is thick, thick polypeptide. And then they have pentaglycine bridge, pentaglycine bridge they have, and T for teichoic acid, which is for attachment, teichoic acid. They have, this is a positive people. Negative people, what happened? They are negative, so full of lipids and sugar, lipids and sugar. So that means they are lipopolysaccharide. Lipopolysaccharide means only gram-negative bacteria. And negative people are always introvert. They always stay inside the home, introvert. So endotoxin. So endotoxin and lipopolysaccharide word comes, it's only gram-negative bacteria, right? And again, in gram-positive bacteria, McDonald's, gram-positive people go and eat in the McDonald's. So you should know all the thing. M for, I'm not writing everything. Microbiome TB. A for actinomyces or anthrax. Actinomyces anthrax. C Clostridium, D diphtheria, two diphtheroids, N for nocardia, S for staphylococcus and streptococcus. Rest all are gram negative. Do I see an E. coli here? Definitely not. So E. coli is basically a gram negative bacteria. So in gram negative bacteria, what should they have? I should have a lipopolysaccharide layer and endotoxin. So there is a there is a polypeptide here, but it's thin polypeptide. But main thing is lipopolysaccharide and endotoxin. So it has a lipopolysaccharide layer. Of course, yes, it's a gram negative, so it's having lipopolysaccharide. Thin peptidoglycan, definitely yes, because here it is thick. Positive people are thick, negative people are thin. So thin. Pentaglycine bridge, definitely not. That is for positive people, PPT people, okay, positive people. Produces both exo and endotoxin? Of course, yes, endotoxin, but both of them produces, exotoxin is common for both. Exotoxin, exotoxin. Both of them are producing exotoxin, exotoxin. Okay, you see in both. So that is also correct. Endotoxin, specifically gram negative produces, endotoxin produce only in gram negative, but exotoxin produced by both gram positive and gram negative. That's all. So we have done. So we have finished. So this is a very, very, doctors, believe me, believe or not, whatever we studied, 70% of questions are going to come in this 71 questions only, whatever we discussed. Different format here and there, they can twitch. 70% I don't want to be overconfident, but this will be a really a great revision for you. Okay. So that's sorry, I thought to make this video a bit earlier, especially for FMG student, but unfortunately it got delayed. So if you get a time, please go through it once, or I'll send the PDF also, go through two revision. Hardly you take on half an hour for revision. Okay, everything if you have seen the video, then it'll be quick. You can easily make before exam two revisions very super you will do. And for of course, for Neet PG and Inicet students, you have plenty of time. So go through properly. Also, mark wherever you're making your main notes. So write all these points, whatever you missed or whatever. Any doubt is there, you can put it in YouTube. We will discuss more. And once again, all the best. And I have so much confidence in you, especially coming from microbiology. I know you are going to do great. All the best again. Okay. So we'll soon meet in another session. Okay. Do great, and I'll wait for you people. Okay. Take care.